Laura, mhm. Can you hear me?
We can hear you.
Okay, that's all I wanted to know. I'm homesick, so you're gonna get Darth Vader when I speak.
Sound check, 1, 2, 3.
Okay, everyone, we're going to be starting in 1 minute. Up. Good morning, everyone. We're going to start the meeting. Okay. Bonjour tout le monde. I want to welcome those who are in the gallery to the Community Services Committee for Tuesday, September 24th, 2024, and all those online. I wanted to acknowledge that Ottawa is located on the unceded territory of the Algonquin and Anishinaabe Nation, whose culture and presence have nurtured and continue to nurture this land. Before we start, I did want to recognize, as I noted, that we have a number of Carleton University students here. Obviously, we have some Carleton graduates around the table as well, too. And I understand that you are folks are in journalism, which I was a journalist in a previous career, and I wish you all the best, and I hope you have a wonderful experience and learn a lot from sitting in this meeting today. So welcome to you all. I will ask the committee coordinator to call the roll so we can start the meeting.
Councillor Brown.
Here.
Councillor Carr.
Here.
Councillor Desroches.
Here.
Councillor Hill. Councillor Kavanagh.
Present.
Councillor King.
Here.
Councillor Lowe.
Here.
Councillor Plount.
Ici.
Councillor Troster.
Here.
Vice Chair Bradley.
Here.
Chair Dudas.
Présent.
You have quorum, Chair.
Thank you. And I will note that we do have regrets from Councillor Hill. We have no declarations of interest. We have confirmations of the minutes for Wednesday, June 26, 2024. Is that item carried?
Carried.
We received 3 responses to inquiries. I understand that one item from Councillor Lowe, 4.3, the City of Ottawa Public Art Program, is being asked to be deferred to the next meeting for addition to the agenda. Is that correct, Councillor Lowe?
That's correct.
Okay, so that does not require a vote. That will just be deferred to the next meeting. And on the other 2 inquiry items, 4.1 and 4.2, did anyone wish to lift those to the agenda or discuss them? I see Councillor Carr, you have your hand up.
Yeah, I was wondering, Kara, if we could perhaps, one with respect to the hours of beaches, wading pools and the like, if we could add that to the next agenda.
So my understanding is Councillor Devine, who had brought forward that inquiry, does intend to discuss it during the budget cycle as an item. And I don't want to speak on behalf of the councillor, but there is conversations about that. So why don't we discuss that offline? Because I think there will be a natural segue for it, regardless of whether it ends up on the next agenda or during the budget discussions.
My concern is that inquiries, almost had a direction in it with respect to the opening of beaches. And those of us that have equity neighborhoods in our neighborhood would like an opportunity to speak about perhaps another angle on that, which is considering opening wading pools earlier in June in those equity neighborhoods where, so I think there's other dimensions, and I'm concerned that we have an inquiry that almost gives direction, and I'd like the opportunity to discuss it at this committee.
Would you like to lift it to this agenda today, or would you prefer to, we could take it offline and see if we can add it to the next agenda or a following one where it makes sense? The reason why is we don't have the individual who brought the inquiry. I don't see Councillor Devine here to speak to his intentions. Not that that is significant. We can discuss it here today, but I do know that there will be a natural segue for discussion of this item at an upcoming meeting. Are you comfortable with that? And then we can discuss where it fits in the next agenda?
Yeah, I'd like the opportunity to discuss it on the next agenda.
Okay. So we won't defer it formally. I do know that there's an intention to have it brought forward at either the next one or the one after. We'll take this offline and figure out with staff what makes the most sense, because I know that this is a very important item that needs to be discussed a little bit more in a fulsome manner. So thank you very much, Councillor Carr, for bringing that up. But we will receive these inquiries at the moment. So we'll move along to 5.1, which is the long-term care person-centered care update. Before we move to staff, they do have a presentation and we do have some delegations as well. I would ask that Councillor Kavanagh speak to give a little bit of a summary about the work that's been done because of her involvement with this initiative.
Thank you very much, Chair. This is a special day and this is a special moment. I'm pleased to introduce the long-term care person-centered care update today. The City of Ottawa's 4 long-term care homes are partnering with residents, families, and staff to transform our homes using a person-centered philosophy of care. It's hard to describe the changes we're talking about because City of Ottawa's long-term care homes already had a very high standard and are at the top of family choices for their loved ones. But this is more. The root of this transformation is organizing care according to residents' needs rather than staff schedules. It's increasing resident choice, autonomy, and decision-making. It's change in our physical facilities and service delivery models, but even more deeply, it's a culture change because it moves staff from getting things done to first and foremost building relationships with residents. When residents are treated with respect, encouraged to maintain independence, engaged in activities, make friends, they can thrive even with dementia and chronic illness. These changes have been in the works for a long time. Before COVID, I sat at this table together with councillors Dean and McKinney. We started to ask about, whenever I hear their name, we started to ask about new things about the butterfly model. But that was getting attention for its innovative model of care, of long-term care, residents with dementia. We wanted that in our homes. Then COVID hit and the long-term care homes went into survival mode like everyone else. The big changes had to take back seat. But the work of researching a model for Ottawa went on. The program we're going to hear about is the result of thoughtful and broad research into best practices in Canada and across the world. As a member of the Person-Centered Care Steering Committee, it's a mouthful, for our long-term care homes, we had the great pleasure of seeing the work unfold and the programs begin to roll out. And I think you'll be excited to hear about this report. I would like to introduce the long-term care services team members who will be presenting today. First, Dean Lett, who has been the Director of Long-Term Care Services with the City of Ottawa since 2016, and Sheila Bauer, who developed the city's custom person-centered care approach. Sheila is a registered nurse with a master's degree in health administration and extensive leadership experience in various healthcare sectors, including acute care, long-term care, and home and community care. She's served as an administrator for Peter D. Clark, Gary Armstrong, and now leads the quality initiatives and person-centered cares at City Homes. Sheila is actively participating in the sector-wide working groups and communities of practice, contributing to expertise beyond our homes, and we are fortunate to have her leadership. Please welcome Dean and Sheila to provide presentation about this exciting new person-centered care model underway at our 4 long-term care homes. Thank you.
Thank you, Councillor Kavanagh. Madam Chair, long-term care services underwent strategic planning exercise in 2021. Stakeholder engagement and consultation during this process highlighted the importance of prioritizing a person-centered care approach. One of the strategic goals identified during the strategic planning session is enriching residents' lives, which speaks to the focus on strategies to support individual residents to lead fulfilling lives. In addition, many of the strategic objectives are linked to the need for a transformative culture change based in providing person-centered care and services. In 2022, we presented the strategic plan to the Community Protective Service Committee and were asked to return to committee to present an update on our person-centered care approach. Next slide, please. The City of Ottawa operates 4 long-term care homes that are collectively home to 717 residents. Within the homes, residents' populations and care needs are diverse. 70% of our residents have some form of dementia, 69% use wheelchairs, 38% require assistance at mealtime, and 9% speak a language other than English or French as their first language. The average age of the residents in the long-term care homes is 85, and our youngest resident today is 25, and our oldest resident is 108 years old. The care teams at the homes offer a variety of services and specialized supports. We have approximately 1,100 employees working in our long-term care homes. While the City of Ottawa provides excellent care and services to long-term care residents, the long-term care strategic planning process highlighted areas for improvements in meeting individual resident needs. This was in line with similar results across the long-term care sector, which had begun to make progress towards improving resident experiences pre-pandemic. Madam Chair, at this time, I would like to ask my colleague Sheila Bauer, who's the project lead for implementing the person-centered care approach, to provide an overview of the program and work completed to date. Thank you. Next slide, please.
Thank you, Dean. Thank you, Councillor Kavanagh and Madam Chair. So I'm quite excited to be here this morning. This is a really good news story for long-term care and for the city. So as Dean indicated, we had a very robust strategic planning process with a lot of rich feedback, and almost an imperative was put forward that the City of Ottawa needed to develop for long-term care, needed to develop this different approach to care, a person-centered care approach, but also that we needed to be leaders. So we took that sort of feedback quite seriously. But what to do? So as we heard, there's a butterfly model. The long-term care sector was sort of having discussions about different models of care. And we took it upon ourselves to review various models and decided that the best approach for us would be to build on the strengths and the commonalities of the model and customize our own approach to care, which is what we did using a co-design approach. So the essence of it really is moving from a very kind of regimented, task-oriented way of providing care and support to people to one that recognizes residents as individuals, where you can focus on their holistic needs and their kind of emotion-based care and connecting them with connecting them to what their needs are. We also looked at ensuring that in empowering residents, we'd shift that decision-making as much as possible to them and not indicate that the schedule that they're following needs to be what works for us. It really needs to be what works for them. So we also looked at enhancements to the physical space. If you look at some of the corridors, I would say, or some of the neighborhoods in our long-term care homes, they might look like acute care hospitals at times. They have a nursing station, long corridors, and we wanted them to feel more home-like. So it was important to kind of create that feeling, that sense of homeness. Also looked at the importance of consistency in staff. So you can only imagine what it's like to have a new person providing you with care every day. You really want to ensure that you have that consistency so you can build that relationship and that bond. And so that's quite important. We focused a lot on that. And also very important to have an environment that's stimulating, that's exciting, that's vibrant for staff. If staff are engaged and finding their work meaningful, they love it, right? And that's absolutely wonderful for everyone. Next slide, please. So what does it look like on a very, very basic level? Residents are, I don't want to say allowed, but residents live according to their own kind of rhythm and schedule. So a resident wakes up naturally. They're not waking up when we're waking them up. So kind of a rude awakening every morning. They have strong relationships with staff and other residents. And certainly during the pandemic, that was very clear how much that the residents missed being able to move from one neighborhood to another to support each other and build those friendships. So that is important for them. They want looking at participating in things that are meaningful to them, activities that they're interested in, not just what's being offered that day. And again, focusing on spaces that are home-like, that have things to do that they can engage in, and things that are fun. For staff, it's again stressing the importance of relationships, the relationships with families, the relationships with each other and with residents, that they are involved in decision-making, as residents and families are from this co-design approach. They have the flexibility in their routines, so they're not asked to do everything at a particular time. It ends up, for them, it creates a calmer day. They end up not feeling as rushed in providing care, and they feel supported to engage in things that are meaningful to the resident and fun. So it works, it has benefits for residents, staff, families, and for all. And we also acknowledge that residents move into long-term care having lived a life that included risk. And we do our utmost to ensure that they're able to continue living with risk as is a right, and that actually is entrenched in legislation. So that's helpful. So just to give you, next slide, please. Just to give you a very simple example of an intervention that we put in place. And this came from a family member in one of the project advisory committees, and it's called a Getting to Know Me form. And it really helps staff know residents as human beings and not as just a resident who receives care. They're a person who moved into this new home, this long-term care home, with a life history, with experiences, with interests, with likes, with dislikes. And so knowing who they are, it's very helpful in just building your relationship, getting to know them, providing care, stimulating conversations. Regardless of the intervention that we put in place, we always ensure it's aligned to those person-centered care principles of autonomy, respect, dignity, choice. Will it create joy? Like really focusing on those important principles. And always from a co-design approach, because we don't take the position that we're experts. It's a collaborative approach to decision-making. So just a couple of quotes to sort of, I think, support what I'm saying. So from a long-term care family member, I like the resident bios outside of the rooms. It helps staff to know the residents that they're caring for. And from a staff member, the Getting to Know Me document has been incredible. Next slide, please. So we were very fortunate to be able to strike a partnership with the University of Ottawa and the Life Research Institute to help us with the evaluation. We wanted a third-party evidence-based approach to the evaluation, and we wanted to be able to create a framework for that we would be able to replicate going forward. So the pilot project was evaluated, and quite clearly the person-centered care approach is having a positive impact. There's improved quality of life for residents, which is ultimately your goal. Resident, as I talked earlier about waking naturally, they have autonomy when they're waking, they have autonomy when they go to sleep. Their dining experience is enhanced, and in long-term care, the dining experience is very important. It's a social activity, a social experience for residents. Quality of life at work for staff has improved, and that's important because that fosters engagement and better care. The changes to the physical environment are calming, experienced as calming, and staff really appreciated the opportunity to have 2 days of training on person-centered care. And a couple of quotes. A resident, person-centered care is working. I'm an early riser and I'm accommodated. So it's not that everybody wants to sleep in. There are people who actually like to wake up early as well. So both are accommodated. And a staff member, I'm so proud of what I'm doing. Next slide, please. Okay, so next steps. I don't want to say that when I make the comment, we'll be fully implemented across all neighborhoods in the 4 homes by the end of 2026, because it's not really something that you start and stop. It's ever evolving. Because as we heard, it's culture change. It's difficult. Culture change is hard. And as one of my colleagues says frequently, if it wasn't hard, it would have been done already. So we have to be patient with that and understand. We also focus on continuous improvement. So we take feedback quite willingly, and we look at where we can enhance care, how we can enhance quality of life, always focusing on this this ideal that we can improve, and we should. And then celebrating success. We've done a lot of really good work to date. I've highlighted a few things here, but certainly not them all. We've done a lot of wonderful work, and that's in collaboration with many, with staff, with residents, with families, with our steering committee members and all of our project advisory committee members. Next slide, please. I think we have, okay. We were going to show a video, but do we have the video? Okay, all right. So I think the video is short. It's less than 2 minutes, and I do think it kind of depicts what we're doing a little bit better than perhaps my words do. So.
When it comes to our aging population, they deserve the best in care, which is why the city's long-term care homes are doing care a little differently.
To me, person-centered care is very individualized. It's about knowing the person first, putting the person first.
With a person-centered approach to care, residents and their families have more choice and options.
Now, we have to be flexible to adjust to their routine, to their perspectives, give them the autonomy, the freedom, the independence to make their own decisions, to be the drivers of their own care.
Staff are able to work with families to customize resident care.
Person-centered care, it's really about, is staff just understanding mom and knowing what's important to her, what's not important to her, when she does want to do something or not.
And the residents and their family members feel more at home.
We're glad to be here. I just love the people that work here, and I can go home and feel good and know that she's in a secure place and she's being taken care of.
With investments in the quality of life of our residents and in staff engagement, long-term care that is truly person-centered allows everyone to thrive.
So that's the end of our presentation. Thank you, Madam Chair.
Thank you very much for that. We have two, before we go to questions to staff, we do have 2 delegations. So if I can invite Anna Lyle. Thank you for being here, Anna, and you will have 5 minutes.
Thank you, Madam Chair. Good morning. My name is Anna Lyle, and I've been involved with long-term care in a variety of ways for the past 24 years. My first experience was being a family member caring for my father, who was a resident at Gary J. Armstrong, but when it existed as 2 buildings and was known as Island Lodge. Since then, I've been a caregiver for other family members and friends, most of whom have been in our city homes. I've been a family council member, a volunteer in both Gary J. Armstrong and Carlton Lodge, and an executive member of the Champlain Region Family Council Network. This network supports family councils in the 58 long-term care homes throughout Ottawa and the surrounding regions. So working with this very dedicated and passionate group of volunteers has afforded me the opportunity to know about a wide range of long-term care settings. At present, I represent the CRFCN on the City of Ottawa's Steering Committee for Person-Centered Care. There is such diversity in the long-term care population as one would expect. Culture, language, spiritual beliefs, gender identity, interests, talents, differences in cognitive function, varied physical and medical challenges, some people who can speak and others who cannot. The one thing that they do all have in common is their humanness, and each and every resident's greatest need is still to be seen as a person. Paul LaRue, a resident whom I knew well, was a prolific poet, and he wrote a verse that will show you the difference between institution and person-centered care. When you look with your eyes, you see only the shell of the person I used to be, empty, hollow, castaway on the far shore of life. But if you hold me close and listen with your soul, you will hear the roar of the ocean that echoes yet within me, the person I am still deep inside. Through the years and in the various roles I've served in, I've come to know many staff, including nurses, PSWs, recreational staff, others in those in other departments, many fellow volunteers, and of course the residents and families. And it's through these connections and relationships that I have seen and experienced firsthand the difference person-centered care makes in the lives of all. However, I'd rather that you hear from someone who's actually living in one of our city homes. At Carlton Lodge, there is a resident author, Francis Dixon, who has recently completed his 6th book. This one is titled My Home Away from Home, My First Year in Long-Term Care. In his book, Francis describes the individual attention he receives now for his medical needs and all the efforts made to keep him comfortable and safe. He describes the many small, which in long-term care settings are actually very significant, gestures of kindness and thoughtfulness, such as finding a breakfast by his bedside when he needed to sleep in past the regular breakfast hour. He details the choices he is given about times for waking and retiring for the night, the activities available to him, both group and solitary, the access to the outdoors and nature, both in the surrounding gardens and through windows throughout the building. He highlights in much detail in this book the nooks and crannies of the lodge, the quiet spaces for reflection and rest, the places where people can congregate and enjoy socializing, the areas that families can use for family dinners or special celebrations. In other words, the kinds of spaces similar to any one of our own homes. But person-centered care doesn't just have a positive impact on the people living in the home, but also on all who work there. The people who choose to work in long-term care come to their professions and roles because they truly care and want to be of help and service. They want to build relationships and connections, to know the residents as individuals, and to treat them with respect and dignity. Person-centered care takes the focus off of completing and checking off tasks and puts the focus on building relationships, not just with residents, but with families and other staff and volunteers. When an entire team such as this works together, and yes, administration are crucial members of this team, they listen to one another, problem solve together, support one another, trust each other, and there is greater job satisfaction and better retention of staff. This builds continuity of care and also saves a lot of money in retraining and recruiting new staff. As Francis will tell you in his book, not everything is perfect and there's still work to do, but he also says he's grateful to be residing in one of the best run long-term care homes in Ottawa, if not in all of Ontario. On behalf of himself and his wife, who has been at Carlton Lodge for 6.5 years, and I would venture to say for many of the residents of Carlton Lodge, he is so grateful to be the person at the center of what is now his home away from home. Paul LaRue was also in the process of writing a book about his home experience, but unfortunately passed before he could complete it. However, he did have his closing statement prepared, a last word to long-term care home operators. The choice is yours. You have the power to render people powerless or to empower them. You can establish an adversarial or collegial relationship with staff and residents. You can reduce resident and family councils to window dressing or enable them to become showcases. You can provide services that are substandard, merely standard, or the gold standard. You can focus on the bottom line, or you can be top-notch. You can follow the line of least resistance, or you can be industry leaders. You can shortchange those entrusted to your care, or you can foster a culture of change. You have the choice. Choose wisely. So on behalf of everyone working or residing in one of our city's homes, we are so grateful that you have seen the need and the importance of this culture change of person-centered care in looking after our vulnerable citizens. And as we heard, not all of them are elderly.
Thank you,
And have
Anna.
given the funds to put in,
Anna.
sorry?
Thank you so much.
Okay.
We're over your time a little bit.
Okay,
That was a
sorry.
beautiful
That's
way to end
fine.
it, but you do have questions, so
Yeah.
don't go anywhere.
Okay,
Councillor
great.
Lowe, you have a question.
Thank you. Not quite a question, more of a comment. Thank you for mentioning Carlton Lodge. Carlton Lodge is in my community in Barrhaven East, and you are right that it is an excellent facility, right? You often hear that city facilities are above standard when it comes to long-term care, especially with all the stories that came out during the pandemic. So it's always great to engage with the administrators at the building. I've engaged with the family council once or twice. And I am aware of Mr. Nixon. And it's just great to hear such a great facility being mentioned. So just a comment, that's all.
Oh, thank you. And I know he wrote this as a tribute to the people that look after him. It's touched a lot of the staff. They've read the book and they feel very validated, very valued.
Thank you so much, Councillor Lowe. Conseillère Plante.
Oui, merci beaucoup. I just wanted to thank you for your presentation. I have Gary Armstrong in my ward, and it's lovely. I know people who just go for walks around that area because it's just so peaceful to be on that little island. I just had a super simple question and kind of related to the presentation. What is our wait time for our long-term, like the city-run long-term care facilities?
Oh, I
Councillor Plante, is that a question for staff or for the delegate? Okay, I saw Dean almost reach for the button, so we'll go to you, Dean, in a moment, but yes, absolutely, the delegation can answer. No, you're good.
That's fine. Yeah. Thank you very much. I was going to say that we're very fortunate with the city to have such locations as the island for Gary Armstrong and Carlton Lodge, which is right beside the Vito River. I'm not sure that, I haven't been to Champlain. I don't know its setting. I know it's sort of near the farm there, the museum. But we are so fortunate to have those settings because so many long-term care homes are humongous institutional buildings with miniature courtyards where that's the only touch with nature that they can have. We really are very lucky in the city. Thank you so much.
Actually, don't go away too soon. You still have a couple more folks who have questions for it. Yeah, you're very popular today.
Good. I was hoping that.
Conseillère Plante, est-ce que tu finis avec la question? Oh, c'est bon. Merci beaucoup. Conseillère DeRoche.
Yeah, sorry, Chair. I'll reserve my questions for staff, and if you can just confirm that staff will be present to respond from our long-term care.
Absolutely. I'm staring right at them, and I won't let them go anywhere until you're done.
Okay.
So,
Thank you.
just if you want to put your hand down, I'll
stand down. Thank you.
Okay. And Councillor Kavanagh.
Thank you very much for your delegation. I just want to make sure we can find out where we can get a copy of the book, because I'd be very interested. So
if you contact Carlton Lodge, they'll put you in touch with Francis Dixon, and he would be more than happy. The money from the book is going into producing another book. He has big plans for writing more.
sounds great. Thank you again.
Thank you.
And Councillor King has a question as well. Still.
And just a quick request, your delegation was very impactful because it wasn't just your words, but obviously the words of residents of the long-term care facilities and literary words. So just wanted to ensure that you potentially provide a copy of your statement today to the committee for its record.
Oh, okay, I'll figure that one out. Didn't expect that.
It sounds like your statement was incredibly popular. If you don't mind, just to meet Councillor King's request, a city staff member sitting right there at the desk could probably take a photo of your notes and send it to the committee before you leave. So then you don't have to do the legwork. Is that okay?
Okay, I think so. Thank you.
Thank you so much, Anna, for being here. Appreciate it.
Thank you.
Our next delegation is Linda Garcia. Welcome, Linda, and you have 5 minutes.
Oops, here we go. Merci, Madame la Présidente, Councillor Kavanagh. Bonjour à vous tous. Merci encore pour cette opportunité. So everyone, I may be moving to a City of Ottawa long-term care home in 884 weeks. That's about 17 years from now, which will make me the average age of a long-term care resident in Ontario. Which one of you will be sitting beside me? Remember, that was the average age. So some of you are younger than me, but that doesn't mean you won't be in a long-term care home with me. You only have 884 weeks to get it right for me. You know, when I used to teach at the University of Ottawa, I used to tell students, if you don't like what you see in long-term care, you better start working now. I'm absolutely honored to be here today as a member of the steering committee, standing alongside my City of Ottawa colleagues who are taking brave, bold steps to bring back the fundamentals of respect, responsibility, choice, love, and yes, care for the residents of the City of Ottawa homes. And I know there's a lot of work to do. After spending 12 years working at the Ottawa General Hospital back then, that's what it was called, earning my PhD in dementia studies, teaching for 30 years at U Ottawa, researching communication, dementia, and quality of life, sitting on the Champlain Dementia Network for over 20 years, collaborating with colleagues across the city, giving presentations locally, nationally, and internationally. Believe me, I got to see the challenges. I can fully appreciate, therefore, how this person-centered approach the City of Ottawa team is adopting is truly innovative. And what makes it innovative is that it addresses what's the hardest: attitudes, approaches, and most importantly, the people. I'm convinced that living the best life possible in long-term care is fundamentally about the people and their attitude. My research and experiences have shown me time and again how resilient the staff in long-term care is and how resilient families and residents are. I've witnessed time and again how life is more important than anything and how well-being, even more than health, is of prime importance. When I was asked to found the Life Research Institute at the University of Ottawa, I did so with this in mind. The Institute looks at the entire trajectory of life and doesn't define aging individuals by their diseases. It's about who they are. So when the City of Ottawa team wanted to focus on seeing the person beyond their multiple health conditions, when they wanted to give proper care without forgetting about the residents' choices, it only made sense to work with them. We identified ways to collect data on these new innovative approaches that focus on the human connection, the relationships, and the essence of the individual. This kind of work is so important to me that even after retiring from the university, I continued to push for alleviating loneliness and bringing joy to older adults through our Ottawa-based foundation, the Miroir Foundation. If I end up having multiple strokes and developing dementia, I don't just want competent care. I want someone who understands me, someone who remembers I like funky glasses, I love to dance, and I also need downtime and time outdoors. My kids or spouse might not be able to or want to provide that level of care, but maybe one of the City of Ottawa homes will be socially and physically designed to recognize who I am. I want to trust that despite all my health challenges, I can still thrive in my own way. Staying at home may not be the best option for me. A City of Ottawa home just might be. In fact, I'm willing to bet on it. After all, if you're lucky, you live long enough to get old too. And when that day comes, I hope we'll all have a clearer understanding that care means recognizing who someone truly is beyond their age, beyond their health conditions, but as a complete person. So get to it, Ottawa. you have 884 weeks. Thank you very much.
Thank you, Linda. No pressure, right? Time's ticking. Please don't go anywhere. We have a couple of my colleagues who have questions for you. Councillor Troster.
Thank you, Linda. Fellow Funky Glasses wearer, big fan. So in addition to being the councillor for Somerset Ward and a member of this committee, I'm also the council liaison for women, gender, and 2S LGBTQ affairs. And I know among our queer elders, there's a tremendous fear of entering long-term care, of having our relationships erased, of being separated from our same-sex partners, of trans people not having their gender identity respected. I'm just very interested in your research and also in how you think these new guidelines for person-centered care might create better long-term care for members of my community.
I think your community is perfectly situated to push that agenda around person-centered care. There is research going on, as you may know, at the Briere Center with regards to our colleague Arnst Stjinkamp, who is also doing lots of work on that as well. It is an issue, but it really pushes the agenda to think about what is that you need. And we have to remember, I think it was 70% of the residents in long-term care in the city of Ottawa have dementia, which means, you know, in terms of inhibition and so on, you're dealing with a community that wasn't used to living with members of the LGBTQ community. And so this is very important to look at it. And I think it pushes the agenda because it allows you to say, what are your needs? What is it that you need to consider? How can we make things more comfortable for everyone? And that's why I mean, it's about the people. It really is about the people. It's about the attitude that we take. It's about going further. It's about looking at the person and what they need and what they want and how they feel comfortable. It really is. It's like, you know, when you talk about people who use wheelchairs, right? We look at making the environment more available to them. And so what you want to do is you want to make sure you have ramps. We have all of these rules in place now to do that. If you take this and if you take that analogy and bring it to another level, you can see that it's the same principle. We're making the environments accessible in different ways, accessible so people can be who they are, they can get where they want. And that's why I think we need to understand that long-term care is a choice. This is something that is actually, you might be in a better environment if we do it right than you would be if you were home.
Yeah, absolutely. You know, the LGBTQ community has decades of experience in community-centered care, you know, starting with the way we cared for each other during the HIV crisis when no medical institution would touch our loved ones. And anyway, I highly recommend interfacing with the Ottawa Senior Pride Network. The city also funds a dedicated staff person to work with the Ottawa Senior Pride Network, like the Good Companion Center, which is like wonderful. They're such a fantastic group. But you know, this is a real opportunity to tackle a very significant fear for my community when it comes to aging, of having our identities erased, or of feeling lateral violence from other residents who may, you know, not even be aware of what they may be saying to folks. So it really, I'm really appreciative of your research and of these new guidelines. I think they have a lot of potential. We have, you know, absolute warriors who fought for all of the basic human rights that now I enjoy, who are reaching the point where they might be entering long-term care. And the thought of them and of their identities being erased is unimaginable to me, right?
Yeah, absolutely. And I think the more voices we have, the better, because, you know, we think about, like, even just food, when you think about it, there are more countries in the world that eat rice than potatoes. And when you think about what we feed sometimes, you know, like when you look at all the different, we're a very diverse community. And so we need to make sure that we respond to those needs of those communities members. So thank you for that.
Yeah, thank you for your advocacy.
Thank you, Councillor Troster. Councillor Kavanagh.
Hi, Linda. Thank you very much for coming out. I'm a liaison as well, a co-liaison on older adults. And you're a good reminder when you're talking about how many days we have left is stretching that out and trying to keep people out of long-term care, even if it's excellent long-term care. And the importance of issues such as loneliness, et cetera, that can lead to people to suffer more and need long-term care earlier. So I think that's an important part of what we do. I mean, even if we have great long-term care, we have to look at what we're doing as a city to help people stay where they are and live full lives. So I don't know if how your research is, but we've been working on this a lot with Norks and Oasis and projects like that. I don't know if you have any comments on that.
Well, I think it's about choice. And but I do think that, I think it's about choice, and people need to look at the environments that they're in, but we need to think about things like loneliness. I think it's very, very important to think about, are people able to flourish? And flourishing means, you're feeling happy, but you're also having meaningful things to do, and you feel important. We had a project where university students are going into long-term care homes, and the students would tell us, I'm getting more out of this than I feel that I'm giving. What does that tell you? That tells you that somebody, even though they have moderate to advanced dementia, could still give back. And I think I think we need to look at those kinds of situations and look at what the person has around them in terms of the social support, in terms of the physical support. And sometimes you can find that social support, especially if it's person-centered care in a long-term care home. All I'm saying is it is a real choice. It's not something that you go to when there's nothing else available for you. When you have multiple health problems like these people have, this is sometimes the best place where you can be, because the people around you know what they're doing.
Yeah, thank you.
Thank you.
Thank you, Councillor Kavanagh. Conseillère Plante.
Oui, vous avez mentionné que vous travaillez dans un centre de recherche. Est-ce que j'ai bien compris? Est-ce que vous pouvez, parce qu'il me semble qu'il y a c'est là où il y a des lacunes, c'est faire des recherches avec les aînés. Pourriez-vous un peu parler de votre centre et s'il y en a d'autres au Canada, parce que je ne suis pas au courant s'il y en a d'autres. Merci beaucoup.
Oui, alors, eh bien, là, je suis à la retraite. J'ai pris la retraite de l'Université d'Ottawa, mais j'ai créé un centre qui s'appelle l'Institut de recherche LIFE, qui porte vraiment sur les trajectoires de vie sur les aînés. Alors, moi, j'ai travaillé pendant plus de 40 ans avec les aînés. Il y a des centres d'études sur les aînés à travers le Canada. Il y a des super grands centres qui sont organisés aussi autour de différents troubles aussi, et puis sur la qualité de vie des aînés. Ce qui est particulier, je pense, par rapport à la recherche, quand on parle de soins person-centered care, c'est que les mesures de qualité de vie sont pas évidentes. C'est-à-dire que quand on mesure la qualité de vie, c'est beaucoup plus facile de mesurer, par exemple, les chutes, ce genre de trucs, mais quand on regarde, par exemple, qu'est-ce que ça veut dire avoir une bonne qualité de vie et qu'est-ce que ça veut dire quand on a une bonne qualité de vie et on a une démence avancée, par exemple. Alors ça, c'est le type de recherche, je pense, qui est un peu, et puis surtout sur la solitude, où on commence à regarder ça. La clé, c'est l'interdisciplinarité. La clé, c'est de travailler ensemble. La clé, c'est vraiment qu'on se met ensemble, qu'on ait quelqu'un qui regarde ce problème-là, la complexité, comme la conseillère Kavanagh mentionnait, l'environnement, le choix qu'on a autour de nous, c'est ça. Alors, il nous faut des équipes de recherche et c'est ça qu'on a essayé de faire à l'Université d'Ottawa, c'est un institut de recherche qui a à peu près, quand j'ai quitté l'année passée, on était plus de 80 chercheurs à travers de 9 différentes facultés. Alors, tu as des gens autour qui viennent de génie, tu as des gens autour qui viennent de l'administration, tu as des gens qui viennent du droit, de la faculté de droit, et c'est ensemble qu'on arrive à régler des problèmes plus complexes. Je ne sais pas si ça répond à la question, ça me ferait plaisir de vous parler après si vous voulez. D'accord?
Merci beaucoup, Linda, pour votre participation aujourd'hui pour la réunion et aussi dans le processus pour le innovative program that we're launching. So thank you so much for that. We are now moving on to questions to staff. I know that Councillor DeRoche had his hand up previously. Don't know. I'll let him come back on the board. I see that Conseillère Plante, you have a question for staff.
Oui, je voulais juste répéter ma question que j'avais posée avant. My question was about wait times.
Madam Chair, the wait times for the 4 city homes range from 117 days to 615 days. And our wait list today has just over 3,000 people on the wait list.
Wow.
What you might want to consider, though, some individuals may be on a wait list for multiple homes for the city. So that's not being tracked today. It's being tracked as so many per each home. So that number is just over 3,000.
Thank you.
Merci, Concierge. Councillor King.
Thank you, Chair. I'd like to thank staff, first of all, for the implementation of this important and impactful change in service delivery. And I'd also like to thank our previous colleagues from the last term, Councillor McKinney and the late Diane Deans, as well as Councillor Kavanaugh, who is our current co-liaison on older adults, for ensuring that this revolutionary approach towards care have been introduced to our long-term care homes. I think what we heard very eloquently from Ms. Lyell about the model being based on a simple yet profound principle that people living in dementia are first and foremost human beings with emotions, desires, and the need for love and belonging. And by creating an environment that feels like home and fostering genuine emotional connections between staff and residents, we can dramatically improve quality of life and well-being. We know that the research has shown remarkable results in homes that have adopted this model, whether it's reduced use of medications, increased resident engagement, and reduced social isolation, improved nutritional intake, decreased in falls, increased job satisfaction amongst our own staff members, and improved family satisfaction and involvement in care. I know that in the report you did underline family involvement as an opportunity for improvement. So I did have some questions around that. I'm just curious, what specific plans are there to expand training and engagement opportunities potentially for family members?
Madam Chair, thank you for the question, Councillor. Today in the homes, we have project advisory committees comprised of residents, staff, and families, and they meet regularly with the lead, Sheila, here today to go over and discuss opportunities for improvements, to be involved in the decision-making around the environment, how we're providing care into the homes. So we have that in place in the homes. We also have a residents council in each one of the homes. And again, that's an opportunity for residents to come forward and share their feedback in terms of opportunities for improving our services. And we also have family councils in all of our homes. So we are engaging with our families through the family councils to also be looking at opportunities for quality improvement.
I appreciate that. I was going to ask whether there was a formal mechanism for feedback from families, but I think that you answered that. My other questions focused on cultural competency. I'm just wondering how the person-centered care approach addresses the needs of residents from diverse cultural backgrounds. We heard in the report that 9% speak a language other than the official languages. So I'm just curious as to how the need of diverse cultural backgrounds are factored into service delivery.
Madam Chair, one of the advantages we have with the workforce that we have in long-term care is we have an extremely diverse culturally background within our staffing levels. And that allows us opportunities to be able to often be able to speak to residents in the language of their choice. It also allows us opportunities to have discussions around cultural requirements for residents. So that's an advantage that we have. We also have, we're in the process of setting up equity, diversity, and inclusion work group in all of the homes. And again, that will be an opportunity to look at it from a staffing side of it, but also looking at it for the cultural side for residents as well.
Excellent. I appreciate that. Once again, you answered my follow-up question, which was going to be around how we were going to enhance cultural competency training for staff. So it's excellent that that's being addressed. I really do believe that implementing person-centered care based on the butterfly model and other models perfectly aligns with our city's commitment to being an age-friendly community, and it supports our goals of promoting health, inclusivity, and quality of life for all residents, regardless of age and ability. And I also think it emphasizes something different in terms of service delivery, frankly, provided by the city versus private providers. So I really do appreciate the work that's being undertaken, and I really thank you for your answers to my questions. Thank you, Chair.
Thank you, Councillor King. Councillor Lowe.
Thanks very much, Chair. How is this? So, you gave your answer to Councillor Plant earlier about the wait times currently in the long-term care system. I'm curious how this might impact how shifting and fully implementing the person-centered care will affect wait times, or not.
Madam Chair, that will be something we'll be able to track, but it's difficult today to forecast what that would look like.
Okay. And what about resourcing in terms of staff resources, staff time, and material resources? Like, are we expecting an increase in provincial funding to reflect that? Are we expecting a budget ask municipally as well to try to address any of that?
That's a great question, Madam Chair. Today, we've increased our staffing levels over the last 3 years from 3 hours of direct personal care for residents to 4 hours. And that increase in staffing was through provincial dollars. We've also received some provincial dollars related to enhancing the environment. So at this particular time and in the budget for 2025, we will not be asking for any additional dollars to support the person-centered care program.
Okay, thanks very much. And this I think really emphasizes the word care in long-term care, and I'm really happy to hear that it's going to continue to be evolved as time goes, because in 20 or 30 years you might have residents who can speak Klingon, so that's going to be super interesting. So thanks very much.
Thank you, Councillor Lowe. Councillor Kavanagh.
Thank you. Thank you, Chair. No, I thank you again very much. It's been a pleasure working with you. We've been working for months on this, and I really appreciated the updates and reports, and it's so exciting to be here and to finally have this report. So to the whole team. But I do have to extend a thank you that I did not include, and that is on residents who came to me, because that's where it came from. I had groups of it was mostly women whose husbands had been put in long-term care with dementia, and they saw the need, and they felt very helpless at the time. So that was what motivated us, because they knew things could be done better, and there was better models out there. So I appreciate the fact that the City of Ottawa has taken that on. It's great. It also reflects the fact that we do need more affordable nonprofit long-term care. We think of affordable housing, but we also need more. When I hear of the waiting lists, that is concerning, and it's going to grow for sure. So I don't know what we can do in terms of expansion, but I'm going to ask that question even though I know the answer. But what can we do in terms of growth?
Madam Chair, it's a great question. And I know you and I have had some conversations in regards to that. I think some of the work that you're doing in the community to help people to stay living in their homes longer, I think that is an excellent opportunity for us potentially to be involved with the older adult plan and how we can be supporting people to continue to live in the community longer. There are campuses of care that are out there today where people are aging in place in those campuses of care, and just something to be thinking about as new long-term care homes are being developed, having the affordable senior housing attached to it, potentially having a retirement home together within that community campus of care.
Thank you very much. Yes, I think that the nonprofit long-term care has to grow for sure. It's not in our control, but we should encourage it for sure, because the growth will be there. And yes, we're working very hard to keep people in the homes they have. Sometimes they don't have choices of where they go because persons can't care for them anymore. So, and we're seeing that in Ottawa Community Housing. We have 22 buildings for older adults, and you can have somebody staying there for 40 years potentially. So, you know, we have to think of next steps. But this is an amazingly great start, and that we're doing it right. And again, thank you so much.
Thank you, Councillor Kavanagh. Councillor Droche.
Thanks very much, Chair. From 8 years, I represented part of Barrhaven that included Carlton Lodge. So I had the opportunity to have some pretty good sightlines and insights on how we administer long-term care and the great care, compassion, and humanity that goes into the work that we do there. And I'm reminded today of a resident, Ann Jarrett. She lived to some 107 years of age, and she was very involved in the Carlton Lodge community. And I was just looking up her a bit today, saying that Ann often referred to many of the staff and residents as her second family. And I think over time we have provided a very fitting level of care and compassion. And I appreciate that this is a new framework for the administration and for the employees. But I'm concerned that the message to the employees, well, we've done it wrong in the past, we now have to do it right. And I'm not sure I would come to that conclusion. I think it's there's always room for improvement, but certainly my experience and observation is that we've put, again, a high level of care and compassion. We've hired the right people to work there. So to the administrator of long-term care, just wondering how you're going to be working with employees to make sure they understand that they've done tremendous work and it needs to continue, but it's not a question of sort of changing something that was wrong and on a path to something that's right.
Madam Chair, and thank you for your comments, Councillor. I just want to say that we're extremely fortunate to have the staff we have working in our long-term care homes. These individuals come to work every day with kindness, compassion, empathy, and they do a very, very difficult job, and they do it really well. And I'm just really proud to be a member of the team, and just to see the commitment that people make to wanting to provide the best quality of life for residents living in our homes. And you're right, we're always looking at trying to make improvements in how we deliver the care and services. And yes, I believe, give very good care today, and we were prior to moving forward on person-centered care. There is room for us, though, to move forward and implement this program across all 4 homes on all the neighborhoods in each one of the homes.
No, I appreciate the answer, and I can't disagree with some of the examples that were provided today or some of the anecdotes today that I think were helpful to giving some understanding and context. But I'm glad you got the opportunity to say that, the staff have been doing their best, and I think to put the residents first. And certainly that's been my observation over the years. And I think, when you go to Carlton Lodge and you look up and around and you see all kinds of dedications and donations from families and because they are so thankful to the care and work that went into staff there. And, we want that to continue. And it sounds like we're going to continue to do that. With that, I'm very curious in terms of how you're going to measure this, right? I'd like to know, I think we have surveys, and we have tried to get feedback on the experience of both the residents and the family, who some cases are in a better position to respond. We can have anecdotes, but obviously that's not enough. I think we need to have some kind of baseline and some sort of measures going forward. And where will we see the benefits of this work? What measures will be used to see the progress?
Madam Chair, so I highlighted during the presentation that we established a framework with the University of Ottawa and Life Research Institute that would help us evaluate. Ultimately, we're looking at quality of life. And as Linda Garcia, Dr. Garcia was stating, it is hard to measure. We do have a tool that we're using to measure quality of life, but that's at a point in time. Throughout our sort of implementation, we look at sort of baseline, and then we look at how we're improving. So we are measuring different things. Yes, we are measuring things such as falls, et cetera, but we're really focusing on quality of life. Are residents experiencing respectful care? Are they allowed to exercise choice? Are they able to engage in activities that are meaningful for them? So we go to the residents and we go to the families and we go to staff and we get their feedback about how we're doing. And then if something is not working, we adjust.
Okay, thank you for the answer. So if I understand correctly, that framework is being worked on. The performance measures and the performance framework for this is still a work in progress. It's not in place at the present time.
Madam Chair, we do have a framework yet that is in place, and we used it to evaluate the pilot, and we will continue with that throughout our work.
Okay.
Because ultimately, we do always want to ensure we're focusing on the right things to lead us to improved quality of life and improved quality of work life for staff.
Okay. And sorry, did I miss it in the presentation that there was a framework and that you'd used this framework and that there was criteria that you evaluated? Maybe I did, but I'll give you that opportunity to enlighten me.
So perhaps I went quickly, but I indicated that we had a partnership with the University of Ottawa and Life Research Institute so that we'd have a third-party evaluation and that it would be evidence-based. And so that is a framework that we're using.
Okay. Thank you for the answer, and I look forward to seeing that realized. And we have a lot of programs and services to the city that are valued by the Auditor General, and oftentimes, almost every time, it's the recommendations are to really enhance the reporting and the performance frameworks so that the public and city councilors can see the true impact. And when you have a shift like that, we want to see that there's been some incremental and positive change that is being talked about today. So those are all my questions, Chair. Thank you for the opportunity.
Thank you very much, Councillor. Councillor Troster.
Thank you so much, Chair. And thank you so much to staff for this report. I mean, this is the first time I think we've discussed long-term care in any depth at this committee since I've been elected. So it was a real learning opportunity. I'll just ask you the same question I asked one of our delegates, which is, first of all, what consultation did you engage in with the 2S LGBTQ community? And also, how do you see these new guidelines allowing queer and trans older adults to be able to age in a dignified way?
Madam Chair, thank you for the question. So last week, actually, we had a member of our city staff reach out to our team to make a connection with Senior Pride. We've met with Senior Pride in the past. It's been a few years now since we've met with them. We also were invited to the Senior Roundtable to do presentations and to interact with the Senior Roundtable. But we plan to go back and meet with Senior Pride. I feel strongly that people are moving into our homes today and they're not disclosing their identities, and that's not good. I mean, we're trying to create homes and we want to make sure that when people come in, it's inclusive. We do look at, we celebrate Pride Month, we celebrate events in the homes to recognize, but we have a lot of work still that we can be doing in that area. And I would welcome your feedback if you'd be willing to share information with us as well.
Yeah, absolutely. And the Senior Pride Network are wonderful people, and I really appreciate that you're doing that work. I guess my concern is also folks who need care who won't seek it out because they're scared that it won't be a good environment for them. So happy to follow up in the future on this, and thank you for all your work. I think, these new guidelines represent a lot of hope. I loved hearing some of the concrete examples of change, and I just think, what a perfect analogy too about most people eating rice versus potatoes. I mean, I think, whether it's a school lunch or a meal served in a long-term care facility, I think all of our public institutions need to learn to celebrate the diversity of who people are. We don't want people to feel like they have to leave their identities at home, certainly at their end of life. So thank you so much.
Thank you, Councillor Troster. I see Councillor Kavanagh and Councillor Droche have hands up. I'm not sure if those are legacy hands or did either of you have another question? Okay, so I think perfect. Okay, so I don't see any further questions for either of you. I wanted to thank you, Dean and Sheila, and I wanted to thank Councillor Kavanaugh as well for all the work you've done, as well as all the stakeholders and community members, families that have been involved. You know, it's interesting, you know, Dean, you spoke about your staff and how phenomenal they are. They are truly exceptional. And I really, it struck me, Sheila, too, when you said that, you know, this is an integral part of being a home for these individuals. And long-term care facilities is such a cold way to describe these places. They are truly not. They're homes for people when they are aged. So I'm so happy to hear that this program is starting up again full force, and that this is going to continue to evolve. So thank you very much for being here in your presentation today.
Thank you, Madam Chair, and thank you to the committee for allowing us the opportunity for the update and for your support.
So we will be, oh, sorry, I should vote. We should vote on this. Is this item carried? Carried. Thank you very much. We will be moving on to item 5.2. This is the update to the Community Safety and Wellbeing Plan incorporation of the former Crime Prevention Ottawa. We do have a number of delegations. However, we will start with a staff presentation. So I'll ask Sarah, the two Sarahs to come speak to this. Staff presentation. So I'll ask Sarah, the two Sarahs to come speak to this. Staff presentation. So I'll ask Sarah, the two Sarahs to come speak to this. Staff presentation. So I'll ask Sarah, the two Sarahs to come speak to this. Staff presentation. So I'll ask Sarah, the two Sarahs to come speak to this. Staff presentation. So I'll ask Sarah.
Apologies, Chair. I believe that was on my end. I'll make the correction.
I was starting to wonder what was going on there. I thought maybe it was me. Oh, that's okay. Everything good?
Yeah.
Okay. Just one moment, everyone, then. Okay, wonderful. I think we're ready with the presentation. Please proceed.
Thank you, Madam Chair. So my name is Sarah Taylor. I'm the Acting Director for Community Safety Wellbeing, Policy and Analytics. And I'll be presenting today with Sarah Mullen, who's a Program Manager for Social Development within the Community Safety Wellbeing portfolio. Next slide, please. En juillet 2023, le Conseil municipal d'Ottawa a approuvé la dissolution de prévention de crimes Ottawa dans le rapport sur l'examen de 10 organismes consécutifs en affectant son personnel et un budget annuel de 1,2 million au secteur d'activité des services de la sécurité et du bien-être dans les collectifs, des politiques et des données analytiques dans le cadre du processus de budgétisation de 2024. L'objectif d'aujourd'hui est de fournir une vue d'ensemble de l'approche et des recommandations visant à intégrer les objectifs et le mandat de l'ancien programme de prévention et de la criminalité d'Ottawa dans le plan de sécurité et de bien-être dans les collectivités. Next slide, please. Il est important de reconnaître le contexte. Oh, sorry, can you go back a slide, please? I got excited with my French. No, merci. And maintenant, Sarah will talk about the approach that we took in the development. Over to you.
As part of this development of this report, these are the steps that staff took. Staff compiled a list of over 100 individuals, ensuring that there was representation from people that understood and have expertise of the former Crime Prevention Ottawa's goals and mandates, have a range of experience working in these areas. And what that means is that we engaged with former executive directors, former board members, but also frontline staff and volunteers. We ensured that we took an intersectional and gender race lens and ensured that we had diversity of input from people with familiar with the former Crime Prevention Ottawa. We conducted environmental and leading scan practices in crime prevention related to the former Crime Prevention Ottawa's mandates and goals. And we reviewed other municipal community safety and well-being plans that had a more robust crime prevention and safety elements included in that. So that's such as the City of Toronto, the region of Peel, Niagara, and York.
Il est important de reconnaître le contexte dans lequel nous avons mené ces consultations et influence notre analyse. Priorité que vous pouvez voir sous l'image dans la diapositive. Also, in the summer of 2023, the Ontario government, through the Police Services Act, updated the Community Safety Wellbeing Plan legislation, requiring that municipalities review and revise their community safety wellbeing plans within 4 years after the date it was adopted. To meet the legislative timelines in 2025, staff will develop an approach to review the Community Safety Wellbeing Plan in its entirety with an extensive public engagement process, which will include the recommendations from this report if approved by Council. As a result of the timing associated with the Council motion to dissolve Crime Prevention Ottawa and the upcoming requirement to review, engage, and update the entire Community Safety Wellbeing Plan, staff took an evidence-based approach to develop recommendations for an interim plan until a more fulsome review of the entire plan can occur in 2025. While the specifics of this engagement process have yet to be defined, City staff will follow the City of Ottawa's public engagement policy. Lastly, the results of the analysis data collection activities were layered against the provincial community safety and wellbeing framework. This includes a focus on the social determinants of health, so the conditions in which people are born, grow, work, live, and age, to address systemic factors and root causes for long-term wellness. The Community Safety Wellbeing Framework guides municipalities and their partners as we develop local plans in the most efficient and effective way possible in making communities safer and healthier. The framework includes 4 levels of intervention: social development, which are called social development, prevention, risk intervention, and incident response. Social development being an outer ring that requires long-term multidisciplinary efforts and investments to improve the social determinants of health and thereby reduce the probability of harm and victimization, to the inner ring of incident response, which is immediate and reactionary responses that require a sense of urgency, such as police, fire, or an emergency medical services. These different factors all shaped how we conducted our engagement and the recommendations we're bringing you today. Next slide, please.
Through the engagement process, we learned that one of the most valued priorities of the former CPO was the work they conducted with youth. Research shows that by building positive social environments, providing early interventions, and addressing the social determinants of health, we can address the underlying causes of crime and significantly reduce the likelihood of young people engaging in criminal activities. This approach includes recognizing root causes such as systemic racism and social inequities. To address this, staff are recommending adding a youth priority, community safety and well-being plan, focusing on the positive social development of youth, increasing protective factors against crime, such as education and employment opportunities, mentorship and skill building, engagement, and cultural and recreational opportunity. This is a priority that will focus on youth across the city, ensuring that youth who either in rural, suburban, or in the downtown area are supported. There are many examples of this work already underway, such as the Neighborhood Ambassador Program. The Neighborhood Ambassador Program, or NAP, is a part live in program goals of the program one map to them through leveraging municipal and offer opportunities for personal growth. Ambassadors themselves who are employed the program logged over 20,000 youth-to-youth conversations and provided over 242 referrals. They identified that food, transportation, employment, health, and well-being are one of the biggest barriers that youth are seeing. They also identified safety, mental health, access. All of this information to a neighborhood level helps as the challenges because partners will hold Youth Development Forum in early 2025. This forum will encourage young people that truly needs. Will be an hope to see some of as more we were ensure to share it with your teams.
Next slide, please. So the next two recommendations I'm going to speak about are additions we're looking to make to the integrated and simpler systems priority, which look at different levels of intervention around the community safety wellbeing framework. And so the first around priority neighborhoods. Evidence supports that community-driven place-based strategies are effective for crime prevention. This approach focuses on specific areas, recognizing that safety and well-being isn't one size fits all. It highlights the strengths of local neighborhoods and acknowledges that communities are best addressed to equip some of their own challenges. Across the city of Ottawa, there are neighborhoods that experience greater social inequities, as reported through the Ottawa Neighborhood Equity Index and the Ottawa Neighborhood Study. The Ottawa Neighborhood Equity Index is a tool that identifies disparities between neighborhoods and tackles them in a systemic and organized way. It's based on the World Health Organization Urban Heart Index, and it includes 5 domains of well-being and 28 indicators. Currently, the city has multiple place-based neighborhood-focused social development initiatives. For example, the City of Ottawa's Integrated Neighborhood Service Team works to improve access to programs and services in communities with high equity concerns. Currently, there are 27 priority neighborhoods where INST works. In 2012, Council approved the updated Community Development Framework. This initiative focuses on community collaboration at both the neighborhood and systems level to support community development and resident-led actions in priority neighborhoods. For over 10 years, the framework has helped create tailored solutions for residents facing significant challenges. The Community Development Framework works in some of the same neighborhoods as INST, plus additional neighborhoods such as Rochester Heights, Sawmill Creek, and Osgood. As part of this recommendation, staff will work to align the community development framework and the community safety wellbeing plan to support a more structured and cohesive integrated approach to community and social development in neighborhoods. This will build social development initiatives working to tackle the root causes of crime and enhance community safety. An example of this work already taking place is within Ottawa, there are 16 community houses that work directly in low-income priority neighborhoods by identifying and providing free place-based support programs and services. The community houses create more chances for community involvement and help residents to succeed. 6 of the community houses currently receive funding for community safety and wellbeing workers who focus on identifying and solving problems that individuals and families face in those specific neighborhoods. These workers offer help by sharing information, educating about risk and prevention, and ensuring families have access to basic needs so they can raise their children and stay healthy and safe. Next slide, please. The second component that we'd like are recommending to add to the integrated and simpler systems priority is a risk intervention goal. From leading research, the provincial community safety wellbeing planning framework, and through consultations, the current community safety wellbeing plan should work to incorporate strategies to support risk intervention tactics as it relates to crime prevention. So risk intervention is when there are situations of elevated acute risk that are just at the cusp of requiring an emergency response. The purpose of this goal is to connect at-risk residents with the services they need to prevent crisis situations before they happen. The goal is to work alongside service providers and community to establish collaborative risk intervention solutions, such as situation tables. Tools such as situation tables provide a multi-sectoral risk intervention model for individuals and community. They help bring together staff from public safety, health, and social service sectors to identify people who are at an elevated risk for crisis, and then collaboratively and rapidly connect them to services before they experience a negative or traumatic event. An example of this recently being established in Ottawa is the Downtown Integrated Community Situation Table, which is co-chaired by Sandy Hill Community Health Center and the Salvation Army Outreach, with administrative support provided by the Ottawa Police Services. Within their first, they have 21 active agencies, 10 ad hoc agencies that support, and of the individuals brought to them, half of them have accepted service, which has required the collaboration of 19 agencies to support them in being stabilized. Through this priority, staff will continue to identify collaborations and alignment activities with Ottawa Police Services under their own community safety wellbeing plan. The City of Toronto and regions of Peel, York, and Niagara are 4 examples of community safety wellbeing plans that incorporate activities for their police services and Merci beaucoup. We're confident these recommendations coordinated approach to community safety
that we did development. We get
Thank you very much, Chair. Update to the community and Morrison Gardens as being within Ward 7, whereas these priority neighborhoods are in Ward 8. Therefore, be it resolved that document 3 be corrected by adding the new line Ward 8 between the lines for Winthrop Court and Pinecrest Terrace.
Thank you very much, Vice Chair. So we will move now to delegations. Our first delegation is Tammy Corner. from the Community Development Framework, and Andrea Ann Martel from the Centre de Services Communautaires Vanier. And I understand welcome. Thank you for being here. And you have 5 minutes.
Thank you so much. Bonjour, mon nom est Andrea Martel, je suis la directrice générale du Centre des services communautaires Vanier, contente de revoir des visages familiers et également membre du CDF. Donc, depuis plus de 20 ans, le CDF rassemble les résidents, les organismes communautaires, les bailleurs de fonds et la ville pour travailler avec succès dans les quartiers prioritaires et les communautés rurales, comme nous venons de l'entendre. Ces communautés, ces quartiers prioritaires sont là où les inégalités sont les plus grandes. Et nous travaillons afin d'établir des relations de collaboration qui changent le système et développent des initiatives qui améliorent la vie des gens qui y vivent. Donc, en gros, les organismes travaillent avec les gens qui sont vraiment et réellement sur le terrain. Le CDF comprend plus de 13 partenaires qui sont ancrés dans les communautés qu'ils desservent. Le réseau du CDF entretient des relations de confiance avec les résidents et collabore avec les services municipaux, les conseillers municipaux, donc vous, les bailleurs de fonds et nombreux autres partenaires qui apportent un appui essentiel. Nous sommes ici aujourd'hui pour transmettre le message suivant. Le appuie la recommandation incluse, donc la recommandation 1.1 et 1.2, qui inclusent dans le rapport de mise à jour du plan de sécurité et de bien-être dans les collectivités afin de mettre à jour la priorité attribuée au système intégré et simplifié en adoptant 2 nouveaux objectifs, soit 1, les quartiers prioritaires et 2, les stratégies collaboratives pour les initiatives d'intervention visant à contrer les risques. Je cède maintenant la parole à ma collègue Tammy Corner pour la suite. Merci.
Okay. We envision a city how people are newcomers and those with mental health and use challenges. These inequities have worsened since the pandemic, especially in low-income priority neighborhoods and rural areas. Frontline staff and resident leaders work tirelessly to support people of all ages, but many are struggling with hunger, lack of mental health resources, housing instability, isolation, and gender-based violence. The best people to help us understand and address these challenges are the people most impacted and the partners working directly with them. The CDF meaningfully involves residents in decision-making and is the most effective way to achieve impactful change within priority communities. We help to advance the community safety and well-being, the foundational mechanism for integrated and coordinated place-based and systems change. With your endorsement today, we can strengthen our role and our impact. In 2008, City Council endorsed and funded the CDF as a way of working that is focused, coordinated, strategic, and aligns services and resources to meet community needs. CDF place-based partners work well together. However, most organizations struggle to work in this collaborative way, and we can help organizations work in a coordinated and collaborative way. Support systems remain fragmented, causing well-intentioned individuals and organizations to lack a coordinated approach. This results in uneven investments across communities with limited impact on resident priorities. The CDF has a table of senior decision makers guiding our work. We share a way of working with residents that ripples through our members. The CDF provides funding to communities. We offer training, forums, and supports for residents and partners.
We're just going to go to slide 5, please. Thank you.
We have slides, yes. Residents work with partners engaging neighbors and learning about neighborhood strengths and issues. Together, they form a local committee, plan, take action, evaluate, and reassess. This is the CDF cycle for local initiatives. An example is the Banff Community House came together to heal from community violence and COVID. They hosted recreation activities leading to greater well-being and resident engagement, and they're now working with their city councillor to boost park usage. Since 2016, Rural Osgood CDF has engaged more residents and partners who are addressing issues. They are sharing their learning with other rural areas. For many years, the CDF has been working on several community safety wellbeing priorities, including food security, mental wellbeing, discrimination, and racism. We helped create the Community Safety Wellbeing Plan by involving residents in its development. Since then, we have focused on aligning our efforts. Examples in 2019, we've had a mental wellbeing strategy advancing peer support, partner collaboration, and systems change. We're a member of the Guiding Council, which developed the Alternative Neighborhood Crisis Mental Health Response. In its first month of operation, data shows engagement has been high. We are involved in the poverty reduction strategy and supporting various food initiatives helping to create sustainable neighborhood food systems. In 2023, residents requested action on food security, mental health support, and affordable housing, and asked for an update from partners in a year. We backed the Community Health and Resource Center's resident presentations to Council on these topics. In June 2024, system partners held a forum to report back on these priorities to residents. Today, we express our full support for the recommendations in the Community Safety Wellbeing Plan, which proposes an amendment to include a goal focused on priority neighborhoods within the plan's integrated and simpler systems pillar. Thank you, merci.
Thank you very much. We have a question from Councillor King.
Thank you, Chair. Not so much a question, but just a real vote of thanks for the work that the CDF undertakes. I've seen it firsthand, not just as city councillor, but also on the other side, when I once was a president of a community association, actually sat on a CDF table for Overbrook and saw the incredible insight and lived experience that really shines through in terms of people being able to really shift, in a sense, policy and the delivery of services based on their specific needs. It's a very powerful model, and it's one that needs to endure. And I also want to thank the CDF for its strong advocacy for the establishment of a poverty reduction strategy within the Community Safety and Wellbeing Plan. I know that many people around those tables want to see real ways that the city can meaningfully address poverty reduction, as well as food security. So I really do appreciate the work that the CDF undertakes, and I would just want to
Thank you very much.
Merci beaucoup pour la présentation. One of the reports in the document. Was ever sort of either the opioid crisis or the fallout of the opioid crisis discussed at a CDF table?
Not that I know of. Tammy?
I would, it's not discussed well, it is discussed at a system level table, and we know that the toxic drug supply is having an impact on the community. And residents really do appreciate work that partners have been doing to create safe spaces for people to consume harm reduction. That's what we hear from the community. So I think people are concerned with the change that's happened at a provincial level and the impact that this is going to have on people who use drugs and their safety and well-being as well. So there is, yes, residents do talk about this, and they are concerned about the changes and that impact they'll have on their lives.
Okay, and then just my second question, did the table have any liaising with the schools, either the English board or the French board? Like, did they ever sit on the table, or did you have any discussion with our school boards or 4 school boards?
School boards don't sit at the table, but they do work with partners at a local neighborhood level. So they are involved in various ways in the local planning that I mentioned that happens, but we don't have them engaged at a system level at this point. They used to be, when we had an access to space working group, we worked very closely with them to increase access to space in schools for community to come together.
But the 13 partners, and just
Yeah,
to
yeah, yeah.
complement on
Yeah, I
that,
get
the
it.
13
Yeah.
partners are working closely with the school boards.
Perfect. And then my last one is also to, same question, but for the lack of family doctors. Was that ever, I haven't read your minutes or whatever. I'm just wondering if that
No,
was ever
these are
brought
great
up.
questions, yes.
Yeah.
Because there are many priority issues that residents identified. Food security, mental health supports, and affordable housing being the first primary ones. But however, access to family doctors is one of the, I'd say, next priorities. So yes, that has come up.
Okay, thank you so much. Merci beaucoup.
Merci, Councillor Kavanaugh.
Thank you very much to both of you and all the work that you're doing. And I really appreciate the work on working with youth in the community, which I've seen up close, and it really helps. It really helps. We need so much more. My concern is in terms of physical space. Are you finding that a struggle? Because that's what I'm seeing, is that we just don't have enough physical space to do the things that we want to do. Never mind, also just operational, but I just wanted your comments on that.
Thank you, Councillor Kavanaugh. Yes, we are hearing a lot about access to space, and the CDF used to have a working group that focused specifically on access to space. City was a partner on that, along with the school boards, health and resource centers, community houses, all of our CDF partners. However, that group folded because we created in 2017, we created a number of resources that helped people to access space. Community use of schools used to be a program school boards had, and that funding ended. So since COVID, the end of COVID, we've reconvened, a few of us as a group, to discuss the issue of access to space, because as you say, you're correct, access to space is becoming prohibitive for many community groups to meet. Space is expensive, it's unavailable. So it is a concern that we're facing, and we're looking at reforming our access to space working group.
So you're saying that you used to be able to have more access to school space and it's not available?
You have to pay now, whereas before, through the community use of schools, which was a provincial program, you could apply to use space and it wouldn't cost you anything. Now you can apply to use space, but there's a cost, and most community groups can't afford the cost.
So this is something we should advocate for sure. Yeah, I'm finding that we're really tight, and it's very hard to communicate with schools on this.
Mm-hmm.
Okay, thank you very much.
Seeing there's no further questions for you, thank you very much for being here today and for your presentation. Our next delegation is Medin Admusu. And I do apologize if I said your last name wrong.
That's okay. Medin Admusu.
Oh, okay.
There you
Thank
go.
you. I
Close.
stand corrected. You have 5 minutes.
Thank you. Good morning, everyone. Thank you, Chair and committee members, for this opportunity to speak today. My name is Medin Admusu, and I oversee the Programs and Community Services team at BGC Ottawa, formerly known as Boys and Girls Clubs of Ottawa. I'm here today to speak about the potential impact that will result from the strategic prioritizing of youth, the strategic prioritization of youth in the City of Ottawa agenda. Specifically, I'd like to highlight and give kudos to the spotlight that is being proposed with the establishment of a youth social development priority under the Community Safety and Wellbeing Plan. The first Community Safety Wellbeing Plan had 6 priorities, but none specifically singled out youth development, social, emotional, economic, or any other aspect of their growth. This is an opportunity to build on that initial plan and dig deeper into a population that continues to require specific focus, attention, and investment. This is especially important to spotlight youth development now, prior to the full review in 2025, and for consideration of many other populations as well. As BGC Ottawa, we have been one of several agencies that have benefited from investments in our youth programming focused on crime prevention. I believe that Sarah spoke to at least one example. Sorry, Sarah Mullen did. We see this new priority area and strategic approach as an opportunity to demonstrate what more we can do to reach Ottawa's youth and meet their needs and interests. So I was going to talk about the Neighborhood Ambassador Program. I might just highlight one aspect to add to what was said already. This program started with 3 neighborhoods in 2020 in a partnership amongst 3 partners, Ottawa Public Health, the INS team, and ourselves. And now it's active in over 30 neighborhoods. The result has been almost 27,000 interactions this year alone with young people all throughout the city. They're looking for resources, support in things like employment, housing, justice, services, recreation, and just a caring adult to connect with. Beyond NAP, another example of how we focus on youth social development and engagement is our clubhouse spaces. Spaces are specifically designed to internal and external assets of young people using the developmental framework, which ensures that a caring adult staff is usually with them. In our case, a lot of the times it includes people with lived experience. So as you see, I'm presenting alone, but with partners as well. But I do want to end my presentation with just a few highlights of what our staff get to share in terms of their experiences dealing with young people every single day. These are all real stories and direct from staff working with children and youth directly. Example 1. Our homework club had identified many members who were not reading at grade level. To support the members, we created an ESL program specific to literacy support. After several months, the club is seeing a dramatic several each into their high school and club location. The application interviews where she needed. I was contacted several times through telephone. She was able to get her interview accepted into the program. She was very excited and texted me back. Accepted. Just a couple more examples to try. In working with the youth who was referred to me by the diversion program, one youth this month gained insightful experience through meeting different community members such as an imam and a rabbi. He participated in important discussions which were facilitated to broaden his perspectives about becoming more tolerant in his views and attitude towards us. This reflects the program's core values: inclusivity, belonging, and respect. Example, I don't remember, 4 or 5. I received a call from another club staff asking if I was able to support youth with very serious criminal charge. I sat down with the charges. Limited income, I was connected with the defense attorney I've used in the past, and she took the case instead of it going to legal aid. Also acting as a liaison for the family between the youth and the school as he was suspended, and the father doesn't have the ability or capacity to take time off to contact the school and figure out the logistics of the situation. And to wrap it up, I just want to share a quote from one of our young NAP staff that are doing outreach work. This is what he put in his report. As an ambassador with the Neighborhood Ambassador Program, our impact goes beyond facilitating community engagement. It's about fostering genuine connections and creating a sense of belonging among residents, seeing community together to voice their concerns, share their ideas, and focus on development. With all supporting young people.
Chair, here and all your. It's been great. It is really important in our. Which see that and partnership really important. I don't know if you want to
further. It's a testament to what the partnership brought in the first place in terms of relationships, in terms of sharing information across departments within the city, within community organizations. For us, it's been a great stepping ground for some of the young staff. That's been one of the benefits for sure. And I think it got mentioned a little bit as well. We definitely see it, and it's translated to some of them getting full-time employment with youth outreach. So there's a lot of benefits from it.
Great. In terms of schools, do you have a strong relationship with the schools and the about youth?
In ways, I give examples of our outreach workers. in schools, the specific high schools that they have a program in. Besides that, it's also just connecting with the principals and teachers that our kids go to. So we have programs where they come into to our clubhouse locations, the one in the west or any of the ones, the other three. And then if there's an issue going on, like a homework club or something like that, we'll connect with their teachers in school to find out if there's something we can do outside of the school space.
Oh, great. That's good to hear. Thank you again for you and your whole team.
Thank you.
Thank you, Councillor Kavanaugh. Councillor King.
And I just wanted to echo what Councillor Kavanaugh was relaying in terms of the programming. I know that BGC provides incredible programming through Don McGann on MacArthur, and I've seen it at work multiple times in terms of serving both the Vanier community as well as the Overbrook community, in terms of homework clubs, music, dance, instruction, and sports, but these being mechanisms to also provide youth access to other services if they require them. We know it's a very important model. I think many of us around the table here were pleased that additional resources could have been provided to BGC during a previous budget cycle. And it's important that we ensure that the dollars that are required are provided to BGC and other such services to really ensure that we invest in our youth. So I really am grateful for the work that the clubs do in my area, but not just in my area, but also through Ottawa. So just wanted to relay that. Thank you, Chair.
Thank you.
Thanks so much, Councillor. Seeing no further questions, thank you very much for taking the time to be here today.
Thank you.
Our next delegation is Robin Brown.
Good day. The 613-819 Black Hub that I represent welcomes the addition of a new youth social development priority to the community safety and well-being plan, but we have serious concerns that there's still too much police involvement in many areas that continues to have harmful and sometimes fatal consequences. For example, one of the new goals under the youth social development is collaborative strategies for risk interventions, as some people have mentioned. Page 22 of the staff report on the transition of CPO to the Community Safety and Wellbeing Office says, quote, tools such as situation tables provide a multi-sectoral risk intervention model for individuals that are at elevated risk for crisis situations. Situation tables help frontline staff from public safety, health, and social services sectors to identify people that are at an elevated risk for crisis and collaboratively and rapidly connect them to services before they experience negative or traumatic effects. Through this priority, staff will continue to identify collaborations and alignment activities with Ottawa Police Services, unquote. Now, this sounds a lot like the integrated community situation table the OPS said it developed over last year in collaboration with over 30 community partners. That table is to support the OPS's community outreach, response, and engagement or CORE strategy, initially focused, according to the OPS, on enhancing public safety in the Byward Market and Ridgeau Street area. However, the table will also support the OPS's hotspot policing initiative, which is part of the CORE strategy. Now, hotspot policing is a form of predictive policing, which evidence and reports from local activists indicate too often result in discriminatory practices and increased police brutality against racialized people, especially Black and Middle Eastern youth. This increases animosity between the police and the locals in targeted areas. Such animosity is further aggravated by a focus on racially charged narratives about non-existent gangs, often used to vilify and justify surveillance against racialized youth and communities. Such narratives impede systemic analysis of the roots of street and gun violence and instead place the focus on policing racialized youth. This is not the direction we want to go in, especially since in June, the Ottawa Police released the results of its 10-year traffic stop race data collection, showing not only have things not gotten better when it comes to the OPS stopping Black people, they've gotten worse Between 2013 and 2015, Black people made up 8.8% of OPS traffic stops. By 2023, 10 years later, that number had risen to 18.3%. Also in July, the OPS released its 2023 data showing officers still use force disproportionately on Black and Middle Eastern Ottawa residents, and the OPS hasn't presented a plan to stop doing it. Given that, how can the OPS be seen as a trusted partner? It was great to see the CPO report acknowledge the 2023 Center for Resilience and Social Development report From Punishment to Prevention as a benchmark to inform next steps. But the CRSD report cited youth saying they want a reduction of police presence in youth spaces. It also said individuals living and working in impacted communities identified a lack of available services that explicitly offer support to youth involved in street level violence without implicating the police. Integrated situation tables working with police and youth-focused organizations on predictive policing is in direct opposition to what people cited in the CRSD report are calling for. The CPO report says, quote, although aligning strategies with the Ottawa Police Service will benefit the city's community safety and well-being plan, it is important to acknowledge the experiences of harm that have been caused to some individuals and communities through policing. This acknowledgement is a starting point to work towards solutions that provide the right resource at the right time, unquote. Now, that sounds great until it says that an example of this approach is the recently launched Anchor Mental Health Crisis Response Initiative. However, Anchor is another example of where the police remain engaged at a dangerous, potentially lethal level. And that's because Anchor was created by the Guiding Council on Mental Health and Addictions, which the OPS created and sits on. Due to OPS influence, Anchor is in its current form won't stop incidents like last June when the Ottawa police received 911 calls at 2:11 p.m. about a man with a knife in the Byward Market having mental health crisis and responded by shooting and killing the man 2 minutes later at 12:13 p.m. The OPS's influence on the Guiding Council highlights another issue, the systemic exclusion of voices critical of the carceral system in general and the OPS in particular. I tried to join the Guiding Council, but was rejected. I recently tried to join the OPS Community Equity Council, but was rejected. And I tried to join the Community Safety and Wellbeing Plan Advisory Committee, but was rejected. The CPO report recommends adding 2 public members to the Community Safety and Wellbeing Plan Advisory Committee who are independent of any organization to bring a resident perspective. However, given past experience, we're concerned individuals with perspectives that are too critical will be excluded. If you really want to make youth safer, act on what youth are telling you and make one of the guiding principles of the Community Safety and Wellbeing Plan aiming for less police involvement in all areas, not more. Lives depend on it. Thank you.
Thank you, Robin. There's a question from Councillor Johnson.
Thank you very much, Robin. So I appreciate you being here. So could you expand on, what, whether or not there is evidence or not of gang activity that you referred to?
Yeah, sure. Yeah. Well, I guess I'll start by the first question I would ask is, can you or anyone in here name one gang in Ottawa? And I suspect you can't. Or that's because there aren't any. So CPO's own Ottawa Street Violence and Gang Strategy Report backs this up on page 6, as it says, and I quote, partners involved in the Ottawa Gang Strategy Steering Committee observed that gangs in Ottawa are not particularly organized. In other words, rather than the result of well-organized gangs focused on loyalty and turf, incidents of serious street violence appeared to be the result of conflicts among individuals, unquote. The term gang is often used as a way to sensationalize and heighten fears about what's happening to justify increased enforcement. Now, there are organized white nationalist groups in Canada who publicly talk about having access to weapons and guns, and yet they are rarely, if ever, labeled gangs. There is street and gun violence happening, but the police have done little to interrupt or prevent that violence from happening. Instead, they contribute to creating terrible conditions for youth and then reacting to the outcomes by criminalizing youth and creating additional barriers for them.
I know in conversations that I've had, I've been replacing the word gang with street involved violence or street level violence, those types of terms. Can you describe for us what supports you would suggest are necessary that would effectively address that sort of street level violence?
Yeah, sure. And that's why I referenced the CRSD report, which I was happy to see referenced. The guidance in that report is really the way to go, right? And as I mentioned, you're getting you have a direct input from youth there who are saying they want no police in youth spaces, and then the minimum police presence in the other spaces. So I think just, follow the guidance from that report and what the youth are actually saying.
Okay, thank you very much, Robin. I'll have more questions for staff relating to the same things in some of the conversations I've been having with youth and families who have been affected by gun violence. There is that tension around police presence. So I appreciate you bringing those issues today. Thank you.
Thank you. Okay.
Thank you, Councillor Johnson. Councillor Troster.
Hi, Robin. Nice to see you here again. I'm right here. I'm usually on the other side of the circle. It's weird. So your criticism of the initial police involvement in the Guiding Council on Mental Health and Addictions is well understood. But I just wanted to correct the assumption that police have any control over the operations of Anchor right now, because Anchor is a pilot program in my neighborhood right now. I am intimately connected to the 2 community health centers that are running the program. It is entirely staffed by people with lived and living experience. And there is no police that is involved in the actual operations of the program. So I just wanted to clarify that. The criticism of its founding, well understood and could be disputed by some, but I just wanted to be really clear, first of all, that the early results we're seeing from that program are very promising. And at this point, I don't know of any cases that have required police backup, and the demand is much higher than anticipated. The early data is saying that Anchor in Centertown alone is receiving 8 times the calls of the entire city of Toronto. Yeah, which is pretty wild. So I think it speaks to your point about needing alternatives to policing when it comes to community safety.
And again, there's a lot of great elements of the program. What I was talking specifically about was that when the Guiding Council was first created, the terms of reference said the police would be called, quote, when criminal activity is present. So that means that's pretty broad, right? So after I pushed a bit, it's been changed, I believe, to when it's violent, right? But the problem is that's still like the guy last year in the Barbara Market, right? People with knives are being shot.
Yeah,
right?
I mean, it also depends what the caller is asking for when they call, just to clarify. But no, that point is well understood. And we have another huge concern in Centertown specifically, which is the challenges around public drug use, like in front of schools, in front of people's homes, and not having a specific person to call for that purpose. If people don't want to call police, but Anchor is designed for more of a crisis situation, so this is a threat I intend to pick up on, because a huge amount of the demand for service for Anchor are for those sort of mid-level neighborhood well-being pieces, where we don't have a concentrated dispatch, to get the right outreach workers out there. So just to let you know, that is something I'm working on. And in some ways, the early dramatically huge uptake of Anchor is really validating, I think, to a lot of the points you're making and a lot of the work we're trying to do in the community, but it's also identified where the gaps are, and we're working on those really actively, and looking at alternatives to policing in those situations, because, well understood the problems with criminalization of drug use. And also, simply speaking, those calls are often very low priority when there is someone with a weapon somewhere else or some other situation that might be considered a danger to public safety. But thank you very much for your presentation.
No problem.
Thank you, Councillor Troster. Thank you very much for being here, Mr. Brown. I'll now invite Mohammed Sofa and Carla Thor from the Ottawa Coalition of Community Houses. And I understand you have slides, and the community coordinator will cue that up for you.
Good morning. We're here to support the recommendation to expand the community safety wellbeing plan to include the former work of CPO around around priority neighborhoods and youth social development. Next slide, sorry. We are place-based multi-service agencies located in 16 priority neighborhoods. Our location makes us a unique resource to drive the work of the community safety wellbeing plan. Currently, as mentioned earlier in the report presented, 6 community houses receive community safety wellbeing funding to offer community youth and family support services. We support neighborhoods with all aspects of the community safety wellbeing plan, from poverty reduction to food security, to housing, to mental wellbeing. This is work we know well. The addition of youth is an important piece for us, considering nearly 68% of residents in our neighborhood are considered youth. Next slide, please. The Community Youth and Family Support Services is integrated into community house programs to provide a comprehensive support system for families living in priority neighborhoods. These services center the needs of youth by using place-based, family-centered approach. And then on the slide, you can see we have the 6 community houses which have received funding starting in 2022. So Banff, Blair Court, Britannia Woods, Confederation Court Community House, Deborah Dines, and Russell Heights Community House. Next slide, please.
Okay, good morning. My name is Mohammed. Just as Carla mentioned in the previous slide, 6 community houses received funding from the Community Safety and Wellbeing Plan. These 6 houses served more than 1,000 youth, unique youth, and over 440 parents, with total contacts of about 20,000 services. This speaks to the diversity of the communities. As you saw in the previous map, they're scattered across the city in different wards. And the services were similar in a way that the needs of those neighborhoods were similar, and the programs were targeted as such. But it's been since 2022, and even in that short time, we've been able to demonstrate impact. And we 3 years is not enough to address deep rooted issues, and we are looking forward to seeing what further long-term investment will look like to improve and create long-term impact in our communities. In the spring of 2023 or 4, last spring, we held a youth symposium to engage young people around issues related to inequities and harms in our institutions, particularly in education and justice systems. This marked the sort of the beginning of bringing neighborhoods across the city together and bringing young people together and begin a youth-driven work that will give them voice citywide and in their community. So these young people organize within their local neighborhoods, whether it be Britannia Woods on Ritchie Street or Russell Heights on Russell Road, and in between, and then they would come together at the city level and meet each other to organize. We're thankful for Councillor King for attending and Councillor Lane Johnson for sending representative from her office. In terms of alignment with the, next slide. In terms of alignment with the Community Safety and Wellbeing Plan, the community houses are very well aligned with the work of the Community Safety and Wellbeing Plan, mainly because of where we're located, in the demographics and the communities that we support. So we work along residents, addressing inequities we work with residents to address inequities and drive local solutions. These include services, including health outcomes, which means general well-being for people, working with young people to increase their protective factors, and working upstream, as well as building collaboration. Just to give you an idea of what a neighborhood, a family in one of these neighborhoods, sort of a household income is, it's under $25,000 a year for the household, not individuals. The average household income is under $25,000 a year. And that includes under 68% of the population being under the age of 29 years of age. So as you can imagine, the community houses are the sort of the first responders of critical issues in our community and often crises. Just to give you another example, community houses represent 11 out of the 28 food banks in Ottawa, and that represents about 39% of food banks in our city. That means those 6 community houses that were funded by the Community Safety and Wellbeing Plan had 80,000 visits just for food insecurity, and over 170,000 across the 11 food banks that are within the community houses. Now, all this shows the need that these neighborhoods are often very different from their neighboring communities, and ensuring their success is critical. And we're grateful for the work that has been done so far by city staff and community organizations, as well as individuals who care about our community and who want to advance the well-being of all Ottawans. And so it's critical. We can't have setbacks in this work as we have put a good effort forward in the last round in 2022, and we look forward to further investment in this work. So we'll leave it at that, and thank you for your time.
Perfect. Thank you very much. You have a question from Councillor Plon.
Hi, thank you so much. The slides kind of went quickly there, but did I read correctly? You guys are not in Lower Town, right? For the community house in Lower Town?
We are.
You are, okay, sorry.
No, not in the community, it's not funded.
Okay.
It's not currently, it's not one of the funded, it's not one of the 6 out of the 16 that are funded with the community safety and well-being plan.
Okay, got it. Sorry, I'm just confused. And just so you know, last 2 budget cycles, I did my budget consultations with kids. So I would go into schools. I had a slide deck prepared by our financial team with like GIFs and emojis in it. It was really cute. And we would present the city budget to kids and ask them sort of what they wanted to see in the city. And I'm happy to come to any of your home, like the community houses, and do it with the kids in those areas if ever you want me to, because I do think it's super important to hear what kids have to say and give them a voice in what's happening in the city. And just to give you a bit of context, I'm sure, by the way, you know what's sort of the situation downtown is that we, in Rideau Vanier, we have sort of overlapping crises on top of overlapping crises. So I have the most Ottawa community housing like doors, with some extremely vulnerable people living there, on top of having 700 single male shelter beds, 3 injection sites. And it just creates a lot of tension in the community when people feel like you're prioritizing one group over another. And I would just urge you to sort of maybe keep that in mind whenever you are sort of, and I know I'm not suggesting you don't, but in the Lower Town area, and in the Vanier area, I would say too, it can be a bit dicey because people don't have a lot of trust in government institutions. They feel really pushed aside by them and left out of conversation. So I'm really trying to reach out to people. I'm really trying to get the people involved in city discussions. And I think it does start with young kids. So thank you so much for what you do. And if you want to chat later on about coming to talk to your community houses, I would love it.
We have a youth symposium coming up, so
yeah,
definitely sold, and we'll definitely connect.
When is the next symposium?
It'll be in the spring, 2025.
Merci beaucoup.
Sounds like things will align. That's perfect. Councillor Troster.
Thank you, Chair. Thank you for being here. Yeah, so my question is very similar to Councillor Plant's. So there's the Rochester Heights Community House in my neighborhood, which services West Centertown, where there's also a tremendous amount of community housing, and actually thousands of more community housing, well, hundreds of community homes that are being built, as well as many apartments. So you said, so the community house in my ward and the ones in Councillor Plant's ward are not funded by the Community Safety Wellbeing Plan, is that correct?
Correct. Yeah, they're part of the coalition. They're part of the group of 16, but they were not part of the group of 6 that was funded by Community Safety Wellbeing.
So who funds them is my question. Like, where are they getting the money from?
So so historic coalition, the community houses came together in sort of late 1990s. At that time, from that time to now, there has been funding going for basic coordination. So to open the door of the community house, hiring a coordinator like Kristen, who works at Rochester, and then we look for other resources to bring in. With food banks came in, Comer clubs came in over time, and so on. And when the community safety and funding, community safety and wellbeing plan funding opportunity came, there was only so much funding available, and the funding did not go to everybody. So in this round, one of the asks that we're making is that those who are interested in applying have the opportunity to apply and their application assessed, and that the funds are available to cover more people in the pool.
My question is, the 6 houses that have this funding, what services are they offering that are different from the ones that don't have this funding?
Right. So the 6 houses added a full-time family and child workers to their team, which the others don't have currently.
Okay.
That's the addition, is deepening the child and youth work, outreach, family supports, system navigations, all those services are available at those 6, not available at the ones that are not currently funded. Not available as well as resource. They might do that work with very limited volunteers and some communal effort, but not available through paid staff.
Okay, and so the ones that are not funded, so the bricks and mortar was paid for to build them, but you're saying it's mostly volunteer labor or staff from other agencies that come in to provide services at those community
And
houses?
full-time staff funding from the city, as well as a little bit for child and youth, as well as a little bit for those with food banks.
Okay, so they receive other city
They
funding
receive-
from other envelopes. Okay, thank you very much for the clarification. Look, I'll just say, we have a wonderful program called The Door in Ottawa, where I've been in Somerset Ward, where I've been many times. It draws from kids all over the city, and I'll never forget when I had a conversation with them and I said, what do you dream about in your city? And this young person said to me, I wish there were food banks that were closer to people's houses. And that broke my heart. I said, we can dream way bigger than that. So I'm really grateful for the services you provide. And I have now seen that youth for several years who's thriving in that program and doing all sorts of really cool stuff. But, you know, if our dreams are that small among young people in our city, we have a lot of work to do. So thank you.
Thank you, Councillor. Councillor Kavanaugh.
Thank you very much, Chair. And thank you both for coming out. Britannia Woods, of course, I know very well it's in my community, and the wonderful work that's being done there. It's very much needed, and I appreciate the work, and I appreciate our general manager coming out with me to see the work that is being done for counseling for racialized youth. Really appreciate that. In terms of space and all the things that a community house has to do, it's growing. What's happened is what was a pantry in the back of what was a townhouse is now grown to be a major part, and you're servicing more than just your immediate community. So I just want to ask about the challenges of that, because it is concerning that that we're handling this, but we weren't set up for it at all as a city to deal with.
Yeah, I mean, so just an example of a community house is a community center that operates out of a 3-bedroom or 4-bedroom converted townhome into a center. So infrastructure is difficult to maintain. Just imagine where we are now. And when we talk about community safety and well-being, you know, we talked about family-centered approach. Essentially, we talk about is a holistic support to people who are deprived of basic needs. So if we engage with family, a person, we're engaging with the family. So when someone comes for food, you know, in this little sort of a living room that we have, we're serving 35 households per day. They're coming at different times, and that's where the pressure begins. I really like your comment about if our dream is really about a food bank close our community, then we're already in trouble. That's the sense we have. We have a lot of work to do in our city, but it begins first and foremost taking care of people. These steps, I think, will lead us to something positive down the road, but it's a continual work, and there's a disproportional inequities in our city, and they're obvious and they're clear. And it starts at every level of our city, both from infrastructure to services, to access, to transportation, to housing, you name it, is embedded in all of it. How we come around that and address them and name them is something that I think we grapple with every day, because you come in with your coffee in the morning and someone is waiting for you at the door. And when you're leaving, they ask you not to leave because they need some more work done for them. So these are the type of, I think, challenges that social service agencies face, particularly those who are embedded right in the community. And then we put a brave face on, I think, most days to go and address things, but sometimes they are beyond what individual organizations can do, and they do need this level of thinking.
Thank you. I think it's an important conversation with Ottawa Community Housing because we are growing. Going to a ceremony this afternoon, we're gonna grow, and we have to be realistic about the issues that we're facing and what's needed beyond just units. So appreciate the work you're doing, and we'll continue to work together. I know there's a lot of challenges, and thank you for everything you're doing.
Thank you, Councillor. Councillor Carr.
Hi, thanks very much. Sorry I'm not there in person. But I really appreciate you guys being there here. I have a long history of involvement with community houses. 3 of the 6 that received community safety and wellbeing funding, of course, are in my ward, and was a proud board member of Blair Court a dozen years ago. Just a couple comments, and I think they follow well with what some of my colleagues have said. I really appreciate the focus that you've stated, that your focus is not crime prevention. And I'm hoping that in some of the documentation as we move forward with the city, that we start to use language more around reduction in harm and reduction in trauma, as opposed to always focusing on preventing crimes. One of the important, my experience has been that place-based nature of community houses are so important. And we've spoken to that a little bit. The one thing I have noticed, though, as we've migrated to not only serving more people food banks in the community houses, but in some cases, such as with Blair Court, actually having to absorb food bank responsibilities when other food banks shut down. And I guess my concerns are that in some cases, given the high needs in our communities these days, is that we're losing, everyone's so exhausted and tired that in some cases we're becoming more service focused than program focused. And I'm wondering if you have any observations on that, in terms of, whereas we used to be able to offer a lot of programs, we're now focused on just, referrals, food bank, clothing bank, and just, I wondered if you could share any thoughts on that.
Yeah, I definitely agree with that, especially coming out of COVID. And I think that's where we really see the role of the community safety wellbeing plan and funding in our houses, because if we are able to have someone in that role, some of the other workers are going to be able to focus on going back to programming and really reopening and redeveloping that sector, which is so important and has done so much good work in our communities.
Yeah, that's simple, but I think what it's a resource. So you have the amount of support available, and then the demand. There's a huge delta, right? There's a big gap, and then so we are running to, I think, just responding to crisis that has created this responsive mode in the sector. We definitely have to find some balance in terms of providing. Things like the CDF, those kind of calm programs where people actually create and build and dream about how to make things better instead of getting food and getting government benefits and dealing with crisis and so on. So that hopefully that helps answers your question, Councillor.
Yeah, I think it's one of the challenges as I look at sort of the ambitious nature of what we're setting up here, is that how do we tackle that sort of proactive work in terms of reducing harms, reducing traumas in the community, while at the same time addressing all of the needs that we have just in basic services day to day. And I think it's
Thank you, Councillor. Councillor Johnson.
Thank you, Chair. So I just want to the note that it was really dense and actions, ideas. To attend the one in the spring, I would really say that, especially since one of the comments is political leaders contributor is Ralston is here. And tell him you know, we need to support our as allies, like even though we have the lived experience of these particular issues in some ways, it's sometimes put on the liaisons to do a lot of the in-person stuff. So I would strongly suggest we continue to connect with those liaisons to help them out. I was wondering if you guys, so one of the things I was interested in is, you know, how do we get, so I think what the community houses do really well is that they are that sort of like trusted place that, as the previous speaker said, you know, that is place-based, that people can feel comfortable going. They're not being asked to go to a government program with the big, you know, the big bad or the, you know, the power structures are imbalanced. So more sort of through lines between the community house and the residents that use it into programs and services that could be supported by larger structures like institution and municipalities, I think is a strong way to go. There's one reference to something at the Banff Community House in here that they do called the community prioritizing event. And they're saying that it's when youth come to say what they want prioritized to their community. I imagine that some of those actions have to do with within the very localized community, but do we find that there are actions that are being identified by young people in the houses that should be coming up to those institutions and to the municipality? And how does that currently happen under the community safety wellbeing plan? And would you anticipate with this new focus on youth development, are there ways we could be doing that better?
Absolutely, and that work. Oh, well, thanks for sharing the highlights of the notes, Councillor, and thank you for attending the symposium. You have two community houses, and I know you're well engaged in both of them. In terms of connecting with the system-wide, I think that's the ideal situation, is finding ways to partner and collaborate and bring those with expertise and even get people access to experiences beyond their neighborhood and immediate communities. That being said, that takes time and effort and resources. And, you know, I think, you know, with non-walkable communities, it's becoming challenging to do that, especially for young people and their families. That's something that we're definitely experiencing when we attempt that we've tried transporting people on a yellow bus. It's very costly to do. And then, you know, but all that being said, things like swimming, for example, we've been able to get resources to get young people from A to B, some skating programs, some dance programs. I think if you tailor those things and they're specific and there's a collaboration between those larger institutions and the community houses, it works well. Those are the areas where we notice, but those are areas that also need funding and support. Otherwise, they begin, we put a lot of effort in, and then a year or two they disappear, and then we rebuild the new model. So it's a bit unsustainable to operate that way based on our experience, unless we're intentional about why we're doing it and build it into the institutions' cultures, because it's not just community houses, it's everybody else that also needs to adapt. And sometimes that culture is not there, not just with community houses, but across the sector.
Thank you very much for that. I also take note in the symposium how it was discussed that young people need a place to hang that isn't programmed, you know, that sometimes we can over program or, you know, try and direct people into, you know, some type of literacy or some type of employment or some type of whatever. And it does seem that all of those are necessary as well. But I think that's part of the challenge sometimes as the funder or as the as the larger institutions, that if we're always results driven or outcome driven, or, you know, we move too fast, too far, too fast. And to the previous speaker's point, you know, again, when we're looking at trauma or we're looking at trust, like, y'all aren't going to get that if you just ask people to, you know, do an algebra problem and show that they've learned and mastered XYZ, right? Like, that's not how it works. It's not how it works with, you know, my kids. And I don't think it would be how it works with other kids that have experienced even more pressure to perform or to overcome or to resilience or XYZ, right? So I think that's one of the best one of the other benefits of the community house is that it's a place to just chill and to know that you're going to be safe and that you're going to be supported. So I hope that as we're looking at that youth development aspect and how we partner with your houses, that we don't overprogram or overstep on some of those aspects of youth development that just require time and space to breathe. So thanks again. Always good to see you.
Thank you.
Thank you, Councillor. Councillor King.
Thank you, Chair, and I really just want to thank the coalition for all the work it does on behalf of the community houses. I do have a community house in my ward that's operated by the Rita Rockcliffe Community Resource Center, and they do an incredible amount of work, but obviously they weren't on that list of houses that receive community safety and well-being funding. I'm just wondering if you could speak, and I know this was a concern raised by some of my colleagues around whether there is funding for certain houses, whether there's a need for extension of this funding throughout the network of community houses that are in the city, and what that extension of funding might look like in terms of amounts or needs.
Yeah. So the base funding, the average, let's talk about averages because there are 16 houses here. The base funding, annual funding from the city to a community house is about $140,000. Of that $140,000, that covers youth programming. It covers food bank cost, as well as the community house director or coordinator, as well as the operating cost of the center, everything from printing to supplies to T-shirts for the kids and balls and whatnot, and all the pieces that come in, as well as some renovations. And so you can imagine the $140,000 is base. Literally a base for community houses. What's built on top of that is other short-term funding from various organizations, from United Ways and Ottawa Community Foundation, but usually short-term and usually in small numbers. For example, we share $90,000 from the United Ways Ontario. It's divided into 16 houses. Just imagine what each house is going to get. You end up around under $4,000 or $4,500 annually to support the homework clubs. So the community houses are incredibly resourceful in that sense. As we look at the layering of sort of innovating or having greater impact in the community safety and wellbeing plan funding is an opportune time to increase that funding for community houses and put resources into the community house by bringing a child and youth centered person, since 68% of the people that live in those communities already are younger people. That's sort of where the data is forcing us to invest. Therefore, our focus on children and youth and place-based support for this funding.
I appreciate that. That does mirror what I'm hearing in the community about the need for more funding for community houses, for the expansion of community houses. I know that in Overbrook, we've heard a real direct call for that from residents who don't have that resource. And we know the good work that actually does occur in community houses. I've seen it with my own eyes in terms of community engagement, not just with the youth, but the entire community. They're very important pieces of social infrastructure that do require investment. As to the conference, I just want to say thank you for the invitation, and primarily thank you to the youth who participated in this symposium. I found that they were very impressive, engaging major pieces of policy and having major discussions about that with the hope that translates into policy at the city. And I was really impressed with their focus on the fact that we need more upstream rather than downstream investments, specifically around equity. So really what I had heard was that youth wanted more prevention rather than interventions after the fact, after the challenges emerged. And I think that's important. in terms of building policy through strategic partnerships, advocacy around influencing system transformation, greater civic engagement, and community organizing. These were all amazing things that I had heard at the symposium. And I invite all my colleagues to attend the next one if they can. It was just very powerful when you hear it specifically from youth based on their lived experience. So I really want to thank you for organizing that event. But more importantly, I really want to thank the large number of youth that came out to Bayview Yards to participate in that event. As Councillor Johnson would attest, that the information did not fall on deaf ears. We were there, we're listening, and we want to see their concerns reflected in city policy. Thank you so much. Thank you, Chair.
Thank you, Councillor King. Councillor Plante.
Yeah, looks like I'll be last up. Okay, first point is I just wanted to address Councillor Johnson's suggestion about those sort of third chill out spaces. So we have, and I'm looking over at our Vanier Community Resource Center because we have these amazing sort of 6 to 9 p.m. We open our couple school gyms in my ward, and it's just open, like they can play soccer, they can play basketball, they can do what they want, and they're packed. And they're several times a week. So if anybody is looking just for that sort of third space, the schools are a great place to sort of co-organize those things. You're nodding. I see you, Andréane, because the kids are already familiar, the parents are already familiar. And it's just it's cool to, I've been told it's cool to go there when the teachers are not there. I was like, ooh, okay. The last thing too is Councillor King and I met with Jenna Suds a couple months ago, I believe Minister Suds, to talk about a child-friendly city. This is a designation by UNHCR. So if you do want to check that out, it's a really cool initiative to make cities, obviously not just Canada, but there's already some cities who are designated child-friendly cities, and sort of the work that's involved in that is really interesting. It's just involving children in city consultations, making sure you reach out to them, and it's really neat. I would encourage everybody to check it out. So thank you.
No, we're familiar. The pediatrics center at Vanier.
Yep.
Has been Dr.
Bennett. Yeah.
Dr. Bennett has been. Yeah. So we actually helped out a little bit on that.
Awesome.
Work, so that's great.
Thank you so much.
That's excellent. Seeing no further questions, thank you very much both for being here. Our next delegation is Christine Darmawan from the Carleton Community Health Center. And I believe, Christine, you're virtual and you have some slides as well.
Can you hear me now?
Yes, we can.
Okay, that was a classic case of having to unmute.
Oh, we've all been through it and we'll all be through it again. So
you would
have
think
5 minutes.
after so many years. So good morning, and thank you for the opportunity to speak today. My name is Christine Darmawan. I'm the Program Director for the Parent, Child and Youth Services at the Carleton Community Health Center. And I am taking this opportunity to present a program, a youth-focused program called SWAG. SWAG stands for Students Will All Graduate. So I do have a slide deck. We'll move on to the next slide. So students will all graduate. And you have a picture here of our last graduation. We do a graduation for all of our participants in June. And if you are interested in joining us, just let me know. It is a public graduation. Next slide, please. So the SWAG program is a SWAG that has for overall goal to assist youth who are at risk of not graduating to stay in school and reach their full potential by providing concentrated academic, social, recreational, and individual support. The stated objective that you see on this slide is to increase the graduation rate of vulnerable, low-income, and racialized youth who are at risk of school failure without sustained intervention. SWAG invests in youth at risk of school failure to give them the tools and the support they need to reach their full potential and a positive school outcome, thus mitigating the potential for poor outcome of lifelong adversities associated with failing to graduate. The SWAG program offers a multi-pronged approach, providing youth with academic support towards educational success, alongside supports addressing other determinants of health, such as food security, employment opportunities, mental health issues, through a strong network of community services and clear referral pathways. Can we go to the next slide? The participants of the SWAG programs are youth who have graduated from grade 8 and have been flagged by their school teachers, principals, social workers at being particularly at high risk of having a failure to graduate once entering high school. So vulnerable youth who are at risk of school failure. We focus on low-income social housing neighborhoods in the Carleton area, and we focus on equity-seeking groups, including Black youth and other visible minorities who face adversity. Next slide. Actually, we will move to the next slide because I'm seeing the timer. So the core components of the program are academic support to ensure timely credit completion and graduation, mental health and well-being support, offering resources to enhance emotional and psychological wellness, social recreational activities, life skills development, mentorship program with the Red Blacks athletes, and a nutrition initiative because we are seeing the increased food insecurity. And so we offer a full hot meal, cooked meal every single day, which is 4 days a week to all of our participants. And that is done in partnership with nutrition blocks. Next slide. So we have a great success with SWAG. We are working with youth who are particularly at risk of not graduating, and we do see as a result of participating in SWAG, 85% success in graduation rates. Of those 85%, 73% of the youth go on to pursue a post-secondary education. Next slide. And next slide again. So success factors, I think one of the greatest dimension of SWAG that contributes to the success is really this multi-pronged approach. We emphasize a holistic model that addresses the diverse needs of vulnerable youth. Youth don't struggle in school because math is hard, or because French is hard, or because English is hard. They struggle in school because of all the other things, all the other dimensions and challenges that they're facing in their lives. And so the program really addresses those other dimensions as well as provide the academic support. So we build strong supportive relationship. We provide one-on-one social emotional support. We have strong partnerships in the community, and so we are able to provide appropriate referral. We work on building self-confidence and life skills. Next slide. Next slide. So we are supported by various parties, and I'm very thankful to the City of Ottawa, among others, for the support provided. I've heard these themes of funding and core funding throughout most presentations so far. I won't reiterate it, but we are facing similar challenges. And next slide. And here are some of our graduates. So I know my time is up. I'm happy to answer any questions you have.
Thank you very much for your delegation. I'm not seeing any questions, but we very much appreciate you attending today and sharing those thoughts. We will move to the next delegation. Yaman, I'm going to say this wrong. I do apologize. Oh. Yakomi?
You can just call me
Musa.
Yami.
Oh, Yami. I'm sorry. My maiden name is unpronounceable. I can completely understand. My apologies. Yami, it's welcome to the committee, and you're from the Ottawa Coalition to End Violence Against Women. You have 5 minutes.
Thank you so much. So first off, I just want to say we welcome the addition of the priority for youth to the community safety and well-being plan and focusing on neighborhoods. As was named, my name is Yemi. I use they, them pronouns, and I am the executive director of the Ottawa Coalition to End Violence Against Women. I am a survivor. I'm someone who has been a frontline worker in the city for over 15 years with the Sexual Assault Support Center of Ottawa, Immigrant Services of Ottawa, as well as the chair of the Ontario Coalition of Rape Crisis Centers. And it's important for me to situate my experience as we move through the conversation. So Optiva is a coalition of over 30 plus gender-based violence organizations, shelters, sexual assault centers, grassroots organizations, and individual members of the public. We focus on prevention and policy, public education, amplifying frontline voices, and we convene the sector to support coordination through our coordinating tables. Over the last year, we have partnered alongside the city for the GBV scoping study and hosted a GBV forum in April 2024. And the GBV scoping study was an in-depth analysis around the current needs of the gender-based violence sector, as well as movement here in Ottawa on unceded, unsurrendered Algonquin Anishinaabe territory. Through the GBV scoping study and having the city as a partner, we clearly identified that prevention and mechanisms for prevention are key. And for folks who are unfamiliar, prevention does include programs that engage men and boys and addresses the root causes of violence, not just the, what I like to say is the effects of the leaves that we see on the tree, but rather getting down to the root of the tree as to why violence occurs in the first place. So as mentioned, our focus has been on prevention, and the scoping study data mirrors that in terms of the need for programs for men and boys, as well as addressing cyber safety violence, risk assessments that includes considering the realities of pregnant people, families, and families that are fleeing violence. In our scoping study specifically, and again, this was in collaboration with the city Community Safety and Wellbeing Plan team, there was recommendations around high quality GBV prevention for education that included gender sensitive information available for youth at an early age. So with the closure of Crime Prevention Ottawa, as a coalition, we're really keeping sight on the fact that funding from Crime Prevention Ottawa was critical to programs such as engaging men and boys, Optiva's I Can Manifest Change program, which conducted over 1,000 trainings in the city and is world renowned for its work. But with the dissolution of Crime Prevention Ottawa, we are seeing a decrease in funding that supports prevention work. In fact, across the GBV sector, we haven't seen an increase once CPO dissolved. And so given that there is an ongoing epidemic of IPV, which includes children and youth, and we must not lose sight of that, and including also the recent femicide that was experienced in Ottawa in August, and the fact that the city of Ottawa has declared intimate partner violence an epidemic, we know that on average, one woman, girl, or non-binary person is killed each week. And with an intersectional analysis, these numbers are higher. So in light of these alarming statistics, we are encouraging and want to work alongside to ensure that funding for gender-based violence prevention does not get lost, as it was a key pillar of Crime Prevention Ottawa that supported the work on the ground, specifically with youth, specifically engaging young men and boys, and also with Project Soundcheck, which is a world-renowned program. We know that our partners that are part of the coalition are keeping a pulse on this. And so with that, I'll end there and just say thank you for your time. And I hope that as we move this process forward, that we don't lose sight of that important funding pot. Thank you.
Thank you very much. We have some questions for you. Councillor Troster.
Thank you so much, Chair. Hi, Yami. It's nice to see you. Are you still on the line?
I am still here.
Oh, hello. So I'm not sure if we got a chance to update you, but at the recent AMO conference, which brought municipalities from across Ontario together. Councillor Kavanagh and I were part of the delegations from the City of Ottawa that met with provincial ministers specifically to talk about the need for increased funding for prevention of gender-based violence and the fact that that funding needs to be situated within existing organizations like your own. But my question to you is, how much funding were you receiving from Crime Prevention Ottawa that you are not receiving now?
So for our Engaging Men and Boys program, it was over 60,000. And
Wow.
for Project Soundcheck, it was about 40,000
Per year?
per year.
And how many years were you receiving that funding for?
So this is well before my time, so I may not have like the exact metrics on this, but it was approximately 6 years to my knowledge.
Wow.
And so, yeah.
That's $100,000 a year. And what is the total budget of your organization?
The total budget of the organization is a little under 500K.
Wow. That is a huge percentage of your budget that was cut as a result of the collapse of Crime Prevention Ottawa. Are there other funding streams that you have been able to apply for under the Community Safety and Wellbeing Plan?
So specifically prevention, no. But so that's why we really want to emphasize that, you know, it's critical that we not lose sight of that funding pod that was not just for Octiva, but also for the coalition and our members that addressed gender-based violence prevention. And so currently right now, no. And so we really want to ensure that that doesn't get lost in the conversation as we move forward.
Just to be clear, the 100,000, was that Octavia alone or was that sector-wide in Ottawa?
So that was Octiva alone.
Wow. And do you have any accounting of the other cuts that had to be made to other gender-based violence organizations as a result of this change?
I can definitely get you those metrics from our membership. But yeah, we know that, for example, Planned Parenthood Ottawa, which is a coalition member of ours, did amazing work around reproductive justice and health in schools using funding from Crime Prevention Ottawa. And so we know that there's, you know, complicated realities with CPO, but I think in terms of moving forward, we just want to ensure that that doesn't get lost in terms of funding for prevention, because right now, what we are seeing and statistically what makes sense is that we address the issues at the root cause. And so we see this as a mechanism that will allow that. Yeah.
Okay, well, thank you for being here. As you know, Councillor Kavanagh and I were the people who put forward the motion to declare gender-based violence an epidemic in Ottawa. And since then, we've seen more horrendous cases. I'll be following up on my questions to staff. I am deeply concerned if this transition has led to such dramatic funding cuts in the gender-based violence sector at a time when I know you and we are in crisis on this issue. I think as a city, we have to be really careful when we collapse one organization into another, when we change a funding model. This has a real impact on people's lives, on people's jobs, and on the ability of very small organizations to do really outsized work when it comes to crime prevention, in this case, prevention of intimate partner violence. So thank you, Yami. And if you stay on the line, I'll definitely be asking some questions to staff about this.
Thank you very much, Councillor Troster. Councillor Carr.
Hi, Amy. Thank you very much for your presentation. I appreciated hearing about it. I was just down in Peel for a Safety of Our Cities conference, and I had the opportunity to hear directly from the Safe Centre of Peel about their approach with respect to intimate partner violence. And they have 23 partner agencies collaborate under an integrated model, you know, patching together a variety of grants and in order to make it work, and funding from other levels of government. Do you see any opportunity here in Ottawa for better integration of the various agencies? Or do you feel that you're working effectively with other similar organizations? Like, do you feel that there's an opportunity where we could have more impact? Councillor Troster just spoke about some of the funding challenges. Like, I'd just be curious to know what you see as better opportunities for integration to better serve the sector.
Absolutely. I think that this question directly speaks to the data that we see in the GBV scoping study that was done with all services that do gender-based violence, frontline service, prevention, education, And also we spoke to grassroots organizations that don't work within mainstream institutions. And I think two of the core themes that came up was collaboration, and which essentially is like looking at service and systems coordination. So as an organization, we do convene the sector through our frontline service committee, as well as through our public engagement committee and the GBV leadership table. So we are in conversation with one another, but what we have found is that we need concrete systems, concrete infrastructure that will allow the dialogue and reduce barriers for survivors and for their families as well. And so I think that to your question, service and systems coordination is something that's absolutely a key theme and something that we, alongside the city and alongside the sector, are looking to really integrate in the city of Ottawa as part of a response to the community safety and wellbeing plan. But also just, in order to support survivors, just accessing the support that they need at low barriers. So.
Yeah. Thanks very much. It's, as I look at the whole community safety, well-being and all the partners we have in the city, it is one of those questions in my mind. How do we take such a big scope and really integrate things better and make sure that we're really hitting those outcomes and addressing people's needs? But thank you very much for all the really important work you do in our community.
Thank you.
Thank you, Councillor Carr. Councillor Kavanaugh.
Thank you, Chair. And thank you, Yami, for all your work. As you know, as already been mentioned by Councillor Troster, we met with ministers and their staff on gender-based violence. And there was nodding of heads, and prevention was important. But I think we've got to push on this because I'm very concerned of what I've learned about the lack of funding on the prevention side, particularly. I think there's so much work to be done on education and prevention, and appreciate your frontline work on this. And one of the things they talked about was, working with groups that are already out there. And I think you're Exhibit A on that. So I can't see why they wouldn't. But we do have to have that conversation. That's something we can ask staff about, because this funding does come from the province, and they really need to step up, I think. So I don't know what advocacy you've been doing on your own directly with the province at all, but I'd be interested.
Yeah, I can definitely speak to the advocacy that we've been doing at the province. So we did a delegation for Bill 173, which is to declare intimate partner violence an epidemic. We did cite the need that Ottawa was one of the first cities and municipalities to declare intimate partner violence an epidemic after Renfrew County, which is which are our neighbors. And so at the provincial level, we are calling for an awareness of prevention dollars. We are also advocating for gender-based violence, housing supports, as well as supports for sexual assault survivors. And another key piece around prevention is ensuring that we're rooting it in community-based responses rather than carceral responses, which often we find escalate. So that's been a key aspect of our work, is ensuring that we're talking and advocating not only with the city, but also with the province. And I do want to say that in terms of the community safety and wellbeing team, Sousen and team has been really supportive and has been a great partner alongside Optiva and Safe at Home and the sector. And so we see this as a gap that, we're hoping that can be addressed rather than something that was intentionally done. And that we just don't lose sight of the fact that prevention saves lives. We know it's an epidemic. I don't want to, reiterate the stats, because we know it. We know that there's survivors in the room. And so the real question becomes, how can we act now and find some solutions?
Thank you very much. And I appreciate the lead that Councillor Troster is taking as the new liaison, and definitely the conversation's not over. Much to be done.
Thank you.
Thank you.
Thank you so much, Yamikani, for being here. Your delegation is very much appreciated. Seeing no further questions, we will go to questions to staff. Councillor Troster.
Thank you so much, Chair. I have a lot of questions, so I may have to go back on the list. I think because it's fresh in our minds after hearing from Yemi, I was wondering if you could speak to the funding for gender-based violence prevention, the gap that Yami just spoke to. So is it my understanding that when we folded Crime Prevention Ottawa, that meant they were no longer funded, so they are no longer receiving funding for these initiatives from the city?
Thank you for the question, Madam Chair. So the specific question around the funding going to GBV prevention, I might ask if we can take offline because our contribution agreements and budgets differ from what the presenter has shared. For example, the last funding we have for Project Soundcheck was in 2019 or 2020. So perhaps we can take that offline and ensure that we're all speaking from the right numbers and contribution agreements and then take a step from there.
Okay, I'm happy to take that conversation online. I do want to flag that obviously this is still a huge priority for the city. In my role as liaison, I'm very happy to convene a conversation between city staff and the sector to figure out where the gaps are. But you know, I do think sometimes our funding can sort of shift with public opinion or with new political priorities. And it's really important that we don't let the bottom fall out of some of these important organizations because $100,000 is a significant proportion of a $600,000 budget. So I will just put that concern out there and follow up in the future.
Councillor, can I jump in for one moment? Just behind you. Sorry. I just wanted to add that we've been doing significant work, the team with Yemi and others in the GBV sector over the last year. The scoping study that was referred to was funded through our office. And one of the key priorities was prevention. And so with the most recent call for proposals from the provincial government, because this is ultimately a provincially funded sector, we have been working with the GBV community of partners to put a proposal together to the province based on the outcomes of the scoping study so we can actually fill the gaps. So we know what the gaps are. We've worked with the community and we've even offered to pay for a funding writer, a proposal writer if they need. So we want to facilitate their ability to put that forward.
That's great. And I'll just flag that I would say our conversation with the ministers at AMO was well received. What they did caution is to try to minimize overlap between different programs applying for the same funding, and that the city has a convening role to play in bringing the sector together with one voice to sort of figure out where the gaps are and figure out which agency will take the lead in which way. So that's really great. Back to the substance of the report. Could you just confirm how much money is being made available this year through the Community Safety and Wellbeing Fund?
Thank you for the question. So currently the Community Safety Wellbeing Fund is $2.1 million, which was brought over when the Community Safety Wellbeing Plan was approved in 2021 and issued through a 3-year project funding grant in 2022. So that funding ends in the next year. What we're recommending with today's report is the addition of other funding from Crime Prevention Ottawa to that pot of funding for a total community safety wellbeing funding stream of $2.85 million. What would be available this year is $750,000.
Okay, I don't need to tell you that is a drop in a bucket when it comes to crime prevention compared to what, the police budget was over $400 million this year. Can you just clarify who will be eligible for funding this year? Like which kinds of projects?
According to the funding policy that's attached to the report, the recommendation would be that generally all of the priorities within the Community Safety Wellbeing Plan would be eligible for priorities. The recommendation is that we look on, because of the limited amount of funding, look to different priorities year over year to make that accessible funding to 1 to 5 years based on areas where there's action plans, clear alignment around priorities. So the recommendation for this year would be to focus on youth and poverty reduction.
Now, so this is multi-year funding though that people are accessing if they apply this year, or organizations?
It's project-based funding. It's not sustainability funding, but the project funding could be multi-year.
Okay. I wanted to just talk about the list of priority neighborhoods that was included in the report, because to me it was glaringly obvious that there are no neighborhoods in Somerset Ward included on that list, and Centertown is not included on that list. We have the highest rate of crime in the city. I do have some concerns because is it correct that the neighborhood equity index is based on 2016 data?
Yes, it's based on census data. So it's currently being updated with the latest census, and that will be completed at the end of this year. One of the reasons we're bringing forward this recommendation is for the various neighborhood-based initiatives that you heard about today. So from our community partners, as well as the integrated neighborhood services team, is to ensure there's clarity and around systems and process to find alignment around all of those initiatives. And other teams, as well as, for example, the community engagement team.
Yeah, I'm deeply concerned about using data that's nearly 10 years old, that predated the overdose crisis, specifically in Centertown, because we are in crisis right now in Centertown. And when we talk about children and youth, you know, I attended my daughter's parent-teacher night on Thursday and had to have an encampment of folks openly using drugs moved along from outside my daughter's classroom in view during parent-teacher night. And what I'm hearing in terms of children and youth in my neighborhood is increasingly kids are scared to walk to school. Parents are scared to let them walk to school, that we have so many unmet social needs in our neighborhood that, you know, I feel like a canary in a coal mine, because I'm not sure what will be actually reflected in crime data. Because right now, when people call the police to say there's someone openly using drugs in front of my kid's school, on my porch, you know, right in front of me, they're very often told that police will not come, and therefore this is not recorded in the data. So I have some serious concern, first of all, using 2016 data, and second of all, about whether that data will capture the reality on the ground, because it takes a while for the data to catch up. But I can tell you, we're having a rough go of it in Centertown, because as you know, that's where the new anchor non-police crisis response is focused. To me, it seems a huge omission that Centertown is not included on the list of priority neighborhoods, when even from the 2016 data, the Dalhousie Rochester Heights neighborhood, which we would call West Centertown or Chinatown, it ranks 14th across the city, which is still relatively high need. So can you describe the factors that contributed to Centertown not making it on the list that we currently have?
Thank you for the question. So when the Integrated Neighborhood Services team was established in 2019, and selected the 27 neighborhoods where it works today. The following year, the community engagement team was established as well, and the decision was made that based on the needs in Centertown, the community engagement team would be a more appropriate response at that point in time than the integrated neighborhood services team, as well as given the community development framework is working in Rochester Heights. So it was a collaboration between those different neighborhood interventions to determine which one was most appropriate based on the situation.
Okay, so, and I'm very grateful to the community engagement team. I've been working with city staff to scale up their presence in Centertown, and that's great. So I do have an inquiry that I'll be presenting later, which really just asks for more of the granular reasoning why Centertown was not included, because I do think it's still a huge omission, because the dynamics of the neighborhood have changed. And we're also soon to see 10,000 new residents in that area, most of whom will live in community housing. So I'm very interested to see how that it could be on there. I just have another question, because you mentioned the downtown situation table, but that currently only includes community organizations from Byron Hill, Rockets and Hill, correct? No?
No, and I just, sorry, I know what she's gonna ask, but I can answer her.
Yeah, Councillor Plunkett. So my question is, now I understand the idea is to try to spread this idea of neighborhood situation tables through priority neighborhoods. This is my concern about Centertown not being included on the priority neighborhood list. What are the opportunities for Centertown to engage in that existing structure?
Thank you for the question. So I'd like to distinguish, as I tried to do in my presentation, the two recommendations, one around priority neighborhoods and one around the risk intervention, where the situation table is. So for the priority neighborhoods, The focus there would be on community place-based social development activities. So similar to what you heard the community houses refer to, that the community development framework spoke about. That's primarily the focus of the integrated neighborhood services team. So it's that focus on prevention, upstream social development of, youth, community, families in those areas and neighborhoods. Contrast that, again, based on the community safety well-being framework, to the situation tables, which are a risk intervention, to use the word multiple times, which is really when there's a situation where an individual as a community is on the cusp of crisis or needing an emergency response. So emergency response being police, fire, medical emergency, that there are structures and systems put in place around that individual or the community to help prevent that from occurring. So there are different types of interventions which require different types of skill sets in individuals. And so the situation table, the expansion of that, we would look to use an evidence-based approach, similar to the one that informed Anchor being in Centertown based on the needs there, to look at what that could look like. But currently the downtown integrated situation table isn't neighborhood specific. Most of the service providers there are citywide. For example, the Royal is part of the list. And from my initial conversations, they would be happy and are interested in expanding to other partners citywide.
Okay, well, that's great. That's very, very helpful. But yes, I still stand firm in my deep concern about Centertown not being included, simply because all of the social development pieces are pre-crisis elements, right? Like this is crime, this is ultimately crime prevention. And I do have some concerns that some of the new realities we're seeing downtown are creating new vulnerabilities that require earlier intervention with our youth. So thank you very much. I appreciate all the effort that went into this report.
Thank you, Councillor Troster. Councillor Kavanaugh.
Thank you very much, Chair. No, I appreciate the emphasis on the youth, the social development, and there's lots of work to be done. I just want to make sure that we're talking about stability for funding, because one of the concerns that has been raised is that you get sort of a project-based funding, and it disappears after a while, and the need for keeping that experience and staffing in communities like Britannia Woods, where things are going to be going on for a while, and we have to recognize growth as well. The fact that our neighborhoods are getting more complicated and larger, and population's growing. So what can you say in terms of the stability? Because if we have it project-based, then things run out, and that's been a problem for BGC as well, where programs are project-based, and then it's hard to keep good staff because it's only going to be for a little while.
Thank you for the question, Madam Chair. So that question comes up a lot within the community funding discussion overall. And we know through all of our application processes that the need is greater than what the city has available to it. Through the community funding framework, that's the mechanism to access sustainability funding, which is that 5-year core operational funding. The community funding, or the community safety wellbeing funding stream, we are looking to provide a bit more stability through longer term project funding, which is why the policy is recommending 1 to 5 years to answer to some of what you're receiving. And the reason that the initial call was 3-year project funding was to address that core specifically. In particular, in working with youth, the need to provide stability and to build trust.
I appreciate that. Also, working towards that hub model, which has been already started in Centertown. I think that's something that we're just having to see everywhere. We were never meant to be in the business of food pantries and food banks, but we're kind of it's forcing our hand because it's an existing problem. But it also means that you can get people in who are who have other issues, and that you can have multiple reasons to, interact with residents. How are we looking at that?
Thank you for the question. One of the aspects of the integrated and simpler systems priority within the community safety wellbeing plan is to look at that hub model. Through all of our engagements across any of the priorities, we continue to hear the value that that provides to people of being able to go to access services in one place, and looking at opportunities, as you mentioned, such as food, that attract individuals to that. In the upcoming poverty reduction strategy, we expand further on the ask that will be coming to committee in the fall, hopefully October. We expand further on the vision and what people have said they would like to see the expansion of those hub models look like.
I appreciate that. We're talking about programming, but we also need to talk about space, which is capital funding. And I just want to know how that conversation is happening, because we need more space to run programs and to have good services. So how are we tackling that? And I know I could see that in our Bay Ward for sure, and across the city, that's becoming an issue as we grow, and especially with intensification, particularly in the urban areas.
Thank you for the question. We to date haven't looked at requesting capital funding or building a business case around what a capital funding ask would be to look to support some of these services. But based on some of the delegations and questions today, I could see that coming out through some of our upcoming consultation, for example, around the youth priority, where there may be ongoing conversations with the school board or others to contribute to some of that work.
Thank you. And with our federal and provincial partners who can help us fund those projects as well. Thank you.
Thank you, Councillor Kavanagh. Councillor King.
Thank you, Chair. And I'd really like to thank staff for the recommendations that have been presented to us today. I think there's thoughtful and a strategic approach to enhancing community safety in our city. By adding a new youth social development priority, we are investing in our future by giving our young people the support and opportunities that they need to thrive. And I think importantly, this aligns with many of the strategies that we are putting into place, including the anti-racism strategy, where community members, when that was being developed, clearly asked for a pillar that focused on youth development. I think there's importance around the focus on priority neighborhoods as well, because that does acknowledge that some communities in Ottawa have been historically marginalized. But I think hearing from Councillor Troster, it's also important to note that neighborhoods also evolve and they change. And so it is necessary for us to keep that in mind. If we are developing a place-based approach to empower residents, we want that to occur where needs are across the city. But it's good to know that obviously staff is open to looking at that. And I would take interest to see how that would evolve to really address some of the challenges in our downtown neighborhoods as well. The potential of this is really exciting, but in terms of metrics, how will the success of the new youth social development priority be measured? So I'm just wondering if there are specific metrics or key performance indicators that are planned.
Thank you for the question. So the metrics for the youth priority have not been developed to date. It would follow a similar process as the community safety wellbeing performance measurement framework, where we would identify population level indicators that look at risk factors. So for example, around youth, that might be looking at graduation rates or employment numbers. So metrics that are critical for us to understand for decision making, but as a city council or through the plan, we don't have all of the control over the movement on that, but would want to be contributing towards that. And then once a youth action plan is developed, we would develop specific metrics around those interventions to measure, be it funding or a project. And you would expect logically a sequence of events leading to contribution towards those larger outcomes.
I appreciate that. Obviously, in order to determine success, we have to measure, and at the city, we measure for all our programs. So it's very important that that's undertaken, and it's good that we have a plan to do that. I was also interested in the timeline for implementing the changes before us and how progress concerning that will be communicated.
Thank you for the question. So if the report is approved by council, we would move towards implementation immediately. So one of the recommendations with the youth as an example is to build on work that's been happening around youth forums and youth by holding a youth symposium in Q1 that would lead to an action plan and some key activities. We have some key next steps that we'd like to explore around the other initiatives as well following this year. And then with the funding specifically, we would open a funding call in October.
And I'm really excited about the prospect of that symposium. We saw the symposium that was held by the Coalition for Community Houses, where the youth were tremendously excited. I know that with other elected officials and the Black History Ottawa earlier this year, just at the cusp of the beginning of summer, my office held an event for youth, a leadership breakfast, where we heard many of the same themes that in my mind make this report accurate. Youth asking for opportunities to meet, youth asking for more space, whether it's for just generally networking or recreation, youth wanting to be able to network with each other and to be able to have opportunities to learn about different initiatives, whether they're entrepreneurial opportunities, workforce training opportunities, internship, mentorship, and cultural opportunities, and access to additional educational opportunities. So the last question I had are there plans to collaborate with local youth organizations or schools in developing the Youth Social Development Forum?
Thank you for the question. So a number of the partners who you saw here today speak would be part of those conversations, as well as a broader network of organizations across the city that we already know have tables or structures supporting youth. We would do proactive reach out to them. As part of the Community Safety Wellbeing Advisory Committee, we have a representative from the school board who we would engage as well to determine how the 4 school boards would be interested in participating.
Well, I'm really excited about this prospect, and I'm looking forward to working with staff. Hopefully, the offices of elected officials will also be involved in that forum, because I know that really excites youth who I talk to. They want these opportunities to come together and to learn about all the programs that are occurring in the city. That's one of the things that youth have personally come up to me and said, we weren't aware of all of the amazing programs that are occurring in the city. It's important to put that in front of the youth. And I also understand that the community safety well-being plan also is looking at the establishment of a portal for information for youth to provide them access to services. I heard that time and time again, talking to many youth, that there isn't one specific place that they can go to learn about all of these opportunities. So it will be important to do that, but I think that what's before us is an important first step towards a more integrated, responsive, and inclusive strategy that will improve the outcomes for youth. So I really want to applaud the staff for bringing that forward today. Thank you, Chair.
Thank you, Councillor. Councillor Carr.
Thanks very much, Chair. We'll just start small with some questions with respect to the priority neighborhoods. So first of all, I noticed there was a technical amendment to move some neighborhoods from Ward 7 to Ward 8. I had pointed out in my briefings that Clementine was in Ward 18 in the document, and it should be moved to Ward 17 Just making sure that that was covered, or maybe it was covered off with the draft of the document.
Yes.
Okay, so it's already been looked after. Okay, perfect. I would echo Councillor Troster's comments with respect to neighborhoods. Currently, the neighborhood with the second neighborhood equity index figure is Herringate. But since that data was done in 2016, I lost over 200 homes in that neighborhood that were replaced by different buildings that are not attracting the same population. So I do think some of that, I still think I have a significant population, equity seeking population there. I just doubt it would be at number 2. I am concerned that my Russell Heights neighborhood did not figure into a priority neighborhood. It is almost more than Herringate, which, backs next to Heatherington and Jessica Bradley's ward. So some of the resources are available there, but was surprised to not see Russell Heights in there as well. Was there any consideration, or was that neighborhood ever given consideration? I believe it would probably be one of the top 30 neighborhood equity seeking communities.
I would be happy to get back to you with an answer on that, Councillor.
Okay, thanks very much. So just with respect to sort of a couple questions, I think, from Councillor King and Councillor Plante with respect to school board. I know in Toronto, in their safe TOs, they had 26 action, and one of them was the establishment of Violence Prevention Toronto. And they brought in resources to these tables, which sound very much kind of like the integrated risk tables that you outlined. They brought in representatives, seconded representatives from the school board, and in fact from TC, the Toronto Transit Commission as well. Has there been any discussion to working with the school board to see if there could be more of a permanent presence of school board on these tables? Because I do think it's important. Some of our, particularly the OCDSB, which is 70% of our students.
Thank you for the question. So as mentioned, there's a representative as part of the Community Safety Wellbeing Advisory Committee. There's a representative from the school boards on that committee. We've discussed this report the past 2 meetings, and he is in support and does see there being more close alignment to the school boards now through these proposed recommendations than previously. We've been waiting for council approval to engage in more specific conversations around what that might look like.
Okay, thanks for that. I certainly really appreciate the direction that we're moving in and bringing in that youth pillar and really focusing on sort of that multi-sector partner initiative in terms of addressing some of these systemic issues and that recentering the discussion on reducing harm and violence in the community. Guess my concern is overall, I mean, we're moving in, the youth pillar here. Councillor Troster spoke about Anchor in her community, which addresses a different population. Overall, the community safety and well-being work is significant and requires a lot of integration amongst many sector partners. There's a lot to be done. I'm wondering with respect to staff capacity, like, do we, and not that I'm questioning the staff that are working on this, but I'm concerned that, as we enter into budget season, that we're not going to have the resources to do the work that needs to be done. And I guess in wondering in terms of, organization, are we set up for success in delivering on youth priority, but CSWB as a whole?
Thanks for that question, Chair. What the report, the benefit of the report before you and the work that staff have done is with a view to integrating efforts and aligning and streamlining so that we can bring a more concrete focus to address some of the priority needs in this community. And so integrating the former Crime Prevention Ottawa into the Community Safety and Wellbeing Plan, as well as the budget and the staff, has now given us the requisite capacity to move forward in that regard. And so, yes, we have the resources we need. at this time to move forward on the priorities before you. And in future years, as community priorities shift and change, if more is required, we would be bringing that forward at that time.
Okay, thanks. Like to me, it's not just the integration, but there's so many organizations and agencies that are working together and just sort of, I know it was mentioned about duplication, and just to make sure that we're really well placed to deliver on all this important work. But I look forward to seeing this develop. Thank you.
Thank you, Councillor Carr. Councillor Johnson.
Thank you very much, Chair. So in the Strategy Corp report that was attached to the agenda today, you know, it highlights sort of Canada-wide, and I don't think I need to convince anyone here, but, you know, that we have a disproportionate impact of various systemic issues on, you know, racialized populations. And we do see sometimes racial profiling and over-policing. And so I just wanted to touch on some of the things that our delegates had flagged. You know, when we're looking at these early identification and intervention programs, but trying to move away from, you know, a more criminalizing approach to this work, can you please offer some comments on how moving into this next phase, decommissioning CPO, bringing it under the umbrella of this new framework will consciously examine those biases or bring forward sort of those pro-social supports that those communities require versus, you know, a further stigmatization or identification of neighborhoods that are a concern for fear of, you know, creating a self-fulfilling prophecy with that kind of negative attention.
Thank you for the question, Madam Chair. So that was one of the pieces that we heard through two more broadly, in our literature review of trends as it relates to crime prevention, there is a movement away within that sector and field in the stigmatizing language of that as well. And so the reason that we chose to call it a youth social development priority is really to place that appropriately in the social development sphere, focusing on the social determinants of health and a social determinants of health approach. So the conditions, again, in which people live, grow, work, and age, that look to bring preventative programs, some of which we heard about today, that aren't focused on crime prevention, but the overall well-being of the individuals in those communities.
Speaking, will we see the same amount of involvement from Ottawa Police, more involvement or less involvement from Ottawa Police in this new approach?
So the involvement of Ottawa Police varies based on the initiative and intervention and what we hear from the subject matter experts around the table. And so going to what we've spoken about in terms of holding a youth symposium in Q1, we would look for the youth and those engaged in that activity to develop a strategy and the path forward for what their key actions would look like.
And
again,
oh, sorry, go ahead.
I was just going to say, in the basis of a social development and social determinants of health framework, not a risk intervention or emergency intervention framework, which are the areas where we're more likely to be directly engaging with police.
And so could you comment then on the idea that these community situation tables do create that sort of predictive policing behavior in those neighborhoods? Is that something that you are paying attention to in your work?
Yes, thank you for the question. So Prior to the integrated downtown situation table being established, Ottawa was one of only 2 municipalities in the province that did not have a situation table structure or place. Police normally play an active role in situation tables, in part from what I described previously. The role that they can facilitate is working with individuals who are really on the cusp of needing an emergency response, be that health, police, otherwise. And so province-wide, police refer actually up to 60% of the individuals to those situation tables, but they're only involved in 13% of the responses needed for those individuals. So from the research around that and what's happening in other areas of the province, it's actually a mechanism to remove police from the response and supporting individuals and bring in other health and social providers to support those at that moment in their life.
Okay, thanks. I don't have a timer, Chair, but I've just got a couple more questions. So I just wonder generally with the data that we're collecting, are we going to be collecting race-based data with the city's involvement and also across partner agencies? So when it comes to, individuals that are participating, individuals that are being referred to various places, when you are collecting data, are you going to collect race-based data similar to, how the police had recently done that and they were able to sort of identify whether there was an over presence or under presence of particular groups?
So answering your question maybe generally, so data that would be collected through the evaluation of a specific intervention or table. The Community Safety Wellbeing Development Performance Measurement Framework has the collection of socio-demographic data, so race-based data, as one of the priorities that it strives to integrate and embed in all of the evaluations. And so at an ideal situation, the response to that would be yes. The collection of that data is incredibly complex, in particular for individuals who are at risk or in need. And so a lot of thought needs to go into how those questions are asked, how that data is collected, and then also how it's reported. So as a principle, I would respond yes to that. In practice, it would need to be based on the individuals and community and agencies supporting that intervention. And then always at the end of the day, the individual consenting to self-report in that way.
Okay, thank you so much for the detailed answers. I really appreciate it today.
Okay, thank you, Councillor Johnson. Councillor Plante.
Yes, hi. I was wondering if I could, and I spoke to the chair recently about the strategy corp thing. Is this a good time now to ask questions? Okay, good. Thank you. So I do apologize too. I did read this a bit at the last minute along with all the other documents. So if this has been answered in another forum, just guide me to that. So it says it was written by Strategy Corp. Now my Googling turned up that this is a government relations company. Is that correct? Or was there another one that I missed?
They're a consulting company that are based out of Ottawa or have offices locally in Ottawa as well as in Toronto, and have worked with a number of municipalities in Canada and in the US to write their community safety wellbeing plans.
Okay, and then who authorized this report and how much did it cost?
The funding came out of a federal grant that we have called Building Safer Communities. It was part of our discussions with the Public Safety Canada as a component that can inform the work for the basis of that grant.
And was that grant for all the other municipalities as well, or just ours?
Just a minute. I don't have the number of municipalities that are currently receiving funding through Public Safety Canada for Building Safer Communities, but I can get back to you on that.
Perfect, thank you. So, and then the definition of youth is 0 to 24, which is quite a span. Is that the city's definition as well of youth?
We, as a municipality, do not currently have a policy that defines youth.
Okay, but just, I guess for the sake of the discussion today and the one we will be having in the future about this, this new policy, it would be 0 to 24-ish, or we don't know yet?
It's something we would like to discuss, but we would use that maybe as a starting point. Staff recently attended a series of workshops, and they defined youth much broader, even to 29. So there's lots of definitions out there that we would need to bring together and propose a recommendation.
Okay, thank you. So I do have a bit of some concerns about the report, because the three things just off the top of my head is there's no mention of the opioid crisis. There's no sort of general mention of pedestrianization, traffic, you know, all the things that, especially in low-income areas, that prevent kids sometimes even of leaving the house because their parents don't want them to. And then there's no mention of climate change and the effects of climate change, especially on low-income communities. And I know you sort of said that this is a sort of a general report. It's not, you know, really going knee deep, but it does really feel like you could put Kitchener-Waterloo, you could put Toronto, you could put any municipality in here, and they just kind of switched out the cities. I'll give you an example. So on page 15, they talk about housing insecurity. There's no mention of children living in motel shelters, hotel shelters, which is a big issue in the Ottawa area. On page 23, there's no mention, and we had a discussion earlier about gangs and gang recruitment. This is a big issue in my ward, especially concerning the youth living in our OCH buildings, and their parents have voiced lots of concerns about that. On page 28, it talked about a lot of the community partnership, and there's no mention of French school boards. They just only mention OCD-SB, which I understand it's a big school board, but we have a lot of kids who are learning French, and they offer very specific programming. Is there a plan to update this at all, or will this just be informing generally our policy going forward?
Thank you for the question and for raising your concern. So it is just a baseline at this point in time, and based on the discussions with youth and with youth service agencies as we move forward, where there's areas that require more data and information, it would be updated based on those specific needs.
So what will this report do in terms of informing our policy going forward?
As mentioned, it was an opportunity to bring together existing data sources and a literature review at one point in time as an information packet to begin the discussion around youth in the area. But the next steps will be informed through engagement and consultation, and then will be narrow and focused based on that information.
Okay. Yeah, no, I did want to mention and point out my concerns about this report. Actually, sorry, and I did want to point out too, for LGBTQIA youth, it's mentioned twice, first in the beginning and then again in the sources at the end. Like, it just seems like there's a lot of gaps here, and I understand we couldn't deep dive into every single issue, but you know, for a report from a local company getting federal funding, it seemed like it could have been much better tailored to our unique needs we have here in Ottawa. And I just wanted to express my concerns around that. Thank you.
Okay, thank you very much, Councillor. I am not seeing any further questions to staff. So seeing no further questions, we do have the amendment to the report. So if that item is carried, is that item carried?
Carried.
Okay. And then we have the report itself. Is that item carried?
Carried.
Carried. Okay, thank you very much. And thank you to staff for the presentation and for answering some tough questions and some really good questions. Our next item is 6.1, that's the Community Partnership Capital Programs Annual Report. And we do not have a presentation, but because there is a bit of a change to the program, I've asked GM Chenier to just give a little bit of a preamble.
Thank you, Chair. Good morning, everyone. Good afternoon, everyone. Yes, so what you have before you is our annual report on the minor and major capital partnership program. It reports out on the 2023 minor projects that we approved and makes a recommendation for approval in principle for the major projects. The one item that is different in this year's report is that we are recommending to increase the minor capital partnership program threshold limits for funding. And that is based entirely on the fact that post-pandemic, most recreation amenities and most construction costs have increased significantly. In a prior year, we had increased the limit for projects on city lands from 7,500 to 10,000. This year, we're recommending to increase the limit on city lands from 10,000 to 15,000, and to increase the limit on non-city lands from 7,500 to 10,000. Again, what groups are telling us is that the costs that they are incurring and that we are cost sharing with them have increased significantly for things like play structures, for benches, for all of the things that this program purchases. And so the recommendation is to update that. Within the existing budget, we're not requesting additional dollars. The combined programs have a budget of about $1 million, and we believe that we can do that with the increased limits within the budget envelope that we have. Chair.
Thank you very much, Dan. You have a question from Councillor.
How are you? My first question on this is, how long has this program been in place, the minor and major capital program?
Chair, this program was brought in at amalgamation. It existed prior to amalgamation in the former city of Ottawa proper, and so has been with the new city since inception.
So I'm just wondering, you know, having had this program for over 20 years, if there's been any thought to reviewing this program along with other recreational funding programs. And the reason why I'm asking this is because when I look at where we can get funding for parks and recreation, the new areas tend to get it from DCs. Those areas with higher development tend to get it from their CIL. But if you're in part of, you know, the outer urban area, which has had failing infrastructure for many years, this is one of the few opportunities that you have for funding, but it's reliant on community groups to do fundraising. So if you have areas, equity-seeking areas that don't have that fundraising capacity, this program seems to create some equity issues. When I look at the data, and I've looked at, as you know, Dan, a decade's worth of data on this, we're typically seeing investments in wealthier areas, and you know, we don't have programs that are helping with sort of those more equity-seeking neighborhoods. And I guess my concern is when I look at some of the funding, you know, how can we as a city with limited finances justify some of the costs that we're putting public dollars into private schools, into outdoor classrooms in the glebe, when we don't have funds for our equity-seeking areas in our outer urban neighborhoods?
Chair, a couple of questions embedded in that. In terms of a review, the program was reviewed a few years ago with some minor changes. I alluded to the $10,000 increase for minor capital. It is our intent to review the program. Currently, we're reviewing the cash in lieu of parkland and the development charges. Both of those things are contributing to the sources of funding for recreation amenities. So we're doing those big pieces. We will do this one afterwards. In terms of equity, I can say this, even though this program was not designed specifically with an equity lens, it has over the years played a significant role in bringing equity to areas that probably otherwise wouldn't have those amenities. I know this morning the Boys and Girls Club was here. This program did assist in converting their aging, failing pool at the McCann unit into a field house. It is working with Youth Ottawa to potentially turn an aging city field house into a neighborhood club for youth. It has worked with MIFO to add a gymnasium in an area in Orleans that desperately needs it. It's funded the Miracle League playground and accessible baseball field to bring equity to children with disability who want to play. So even though the specific target and on a neighborhood basis is not specifically looking at equity, it has done some work, and often the ward that is assigned the value of the project probably understates the benefit of the program itself. For example, Pinecrest Park has received over the years quite a bit of funding, as has some of the parks in Orleans, to upgrade baseball infrastructure. And the baseball leagues at both ends of the city will tell you that those benefit a wide range of socioeconomic kids that join the baseball programs. And even though the investments are at large baseball facilities, they really do benefit much broader than that. But having said all that, we will look as we review this program and how we can bring more of an equity lens, excuse me, a more modern approach to what this rather old program currently has.
Thanks, Dan. I appreciate that. So the current recommendations are to increase the level of funding for both properties on city and properties on private land. But how will this program be reviewed? I know you're reviewing the CIL. Are you going to be looking at comprehensively the funding programs for parks and recreation infrastructure in line with sort of, our goals in the official plan and the deficit we're experiencing within infrastructure? Like, how will that overall review look like?
Chair, yes, I think we need to review this to see how it is a part of a larger puzzle of different streams of funding. We need to review how external programs to fund these types of projects have evolved over the years. This program is often cited as the leverage to get funding from Trillium, for example, or from other provincial or federal programs. Once they lock in a city recommendation for this funding, they are able to go and get the matching funding from other agencies. But our intent is to look at how this fits into the bigger puzzle. As the asset management plans come forward in 2025 to council, we will keep an eye on that because, again, even though this program has targeted enhancing recreation opportunities, we know that often it is a solution to replace aging infrastructure with something more modern and better that the community wants to see. And it plays a part sometimes in adding the extra funding that's required to change things in a community.
Thanks, Dan. And just last question. So investments in the major and minor capital programs are not done in line with what's outlined in the Parks and Recreation Master Plan, correct? Is there any link to that?
Chair, when staff review these, the submissions, and this is an application-based program, which in part explains, much like commemorative naming or some of the other programs that are application-based, we deal with what we are given. We would give priority to an amenity or an asset that the master plan has identified and that is missing in a community. We don't have a lot of experience because the master plan is relatively new. In the past, we looked at overall general, what does the community need in that area? Are we aware of, it doesn't have a splash pad, doesn't need one. The master plan provides an extra touchstone on that, and we are using it. And I expect we'll increasingly be using it.
Okay, Dan, thanks. I'll let you go today. I know that you appreciate that I'm hypersensitive to my state of my parks and recreation in my equity neighborhoods, the closure of my community centers over the year, and the poor condition of many of my parks. But I will support the report today, but I'm really hoping that we can start to take more of an equity look at all of our parks and recreation funding in the future. Thank you.
Thank you, Councillor Carr. Conseiller Plante.
Yes, thank you, Dan. Some of my questions have been answered from that exchange, but, and I know you know this, but I just want it to be emphasized that when you have, and if you look at the priority neighborhoods, I had my discussion with staff about it, they were like, so your councillor, your priority neighborhoods are Vanier, Lower Town, and Sandy Hill. And I was like, that's all my neighborhoods. It's not some, that's the whole ward. And I think it's important to recognize, because I do want to underline what Councillor Carr was saying, because the parents in these communities, the residents who live in these communities, housed, unhoused, whatever, they are exhausted. And so the idea of filling out reports and getting support letters and providing statistics and digging things up that people in well-to-do neighborhoods can easily do because they have the expertise, or they, work sometimes in these areas, especially in the federal government. So if there is any way we could keep that in mind in looking at how we put these grants forward, I'm always happy, obviously, to support these kind of projects in my ward, but sometimes just getting people who are already, I would say, méfiant of municipal government or all government is a bit of a slog. So anything we can do to help them make this easier, make this more streamlined, I would absolutely support. And I'd like to have a discussion around that at some point, because I'll give you like the La Joie School example for there's lots of people interested, and that's great. And then trying to get everyone organized, trying to get a letter written, it can just be very, very challenging. So any support you can give on that is really appreciated. Merci.
Thank you very much. I'm not seeing any further questions, and I'm sure, Dan, that everyone will be following up on this. It sounds like it's an ongoing discussion about this. But in respect to this particular item that's in front of us, is this item carried? Carried. Okay. 7.1, status update on inquiries and motions for the period ending on September 13th, 2024. Is this item received?
Received.
We have no in-camera items. We did have one IPD. That is the response to the motion. I didn't hear from anyone that they wanted to lift that, so we'll keep going. We don't have any notices of motion at this time. And on number 11, we do have 3 inquiries. So I will ask actually Councillor Carr to read her inquiry in regarding funding for food security in 2025.
Thanks very much, Chair. I'm wondering if we could put the correct inquiry on the screen. That is about soccer, it seems.
It's because I tricked Eric and I changed the order.
Yeah, I could be the soccer one first.
Okay, that's a good idea, Councillor Choster.
Okay, we'll do the soccer one first.
Okay, very quick. On May 15, 2024, the province of Ontario passed Bill 99, Garrett's Legacy Act, Requirements for Movable Soccer Goals 2024, which requires that any organization or entity that makes a movable soccer goal available for use by members of the public shall ensure that the goal is located on a level service, is securely anchored in accordance with the regulations, and meets any prescribed requirements, and meets any educational, training, or other requirements that may be prescribed. Can staff clarify what the city's requirements and practices are for movable soccer nets, and what actions are being considered or are in progress to be compliant with the new legislation? This is just simply that was brought up by some wonderful parents who volunteer to coach soccer in Plouffe Park, and they noticed that those soccer nets are not secured. And this legislation says that they need to be because they could topple, and we want to prevent that from happening. Thank you.
Wonderful. Councillor Carr, we'll hold off on 1 second for yours. Our next up is also Councillor Troster. So we'll do your next one and then we'll go to the Councillor Carr.
Great. This won't be surprised after the conversation we had. By most metrics, Centertown is a high needs area. Its lack of inclusion on the priority neighborhood list does not reflect the experience of living or working in Centertown. I will just note that there's a typo in the word neighborhood, if we can just fix that in the final version. Would staff please summarize the specific criteria that Centertown did not meet in order to be identified as a priority neighborhood within the update to the Community Safety and Wellbeing Plan incorporation of the former Crime Prevention Ottawa report? Thank you.
Okay, thank you very much. Councillor Carr, if you could read yours in.
Absolutely. Thank you very much, Chair. Appreciate it. My inquiry is food insecurity continues to be raised as a significant challenge amid the ongoing cost of living crisis. Since 2019, food banks across Ottawa have seen a 68% increase in visits, while agencies are receiving less food, less funding. More residents are accessing emergency food assistance citywide. Food security agencies are primarily nonprofits responding both locally and citywide to the need for food. In 2024, the City of Ottawa provided additional support for these nonprofits through the Sustainability Fund budget. The not-for-profit sector cannot continue to operate at this capacity and respond to the growing need without additional ongoing support. Therefore, could staff please explore and advise committee ahead of budget 2025 on the possibility of increasing community safety and wellbeing funding for food security for those agencies primarily operating in food programming and services in 2025.
Thank you very much, Councillor Carr. That is it for inquiries. We have no other business, and we have our upcoming meeting on Tuesday, October 22nd. Can I get approval for adjournment? Carried. All right. Have a wonderful day, everyone.